Good morning, everyone. The meeting of the Committee on Appropriation on the continuation on budget briefing for the Department of Health is now resumed.
Good morning, Mickey.
May I invite everyone to please stand up for the singing of National Anthem.
Bayang magiliw, perlas ng silanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, duyan ka ng magiging, sa manlulupig, di ka masisingil, sa dagat at bundok, sa simoy at sa langit mong baghaw, may nilagang tula at awit sa paglayang minamahal. Ang kislap ng watawat mo'y tagumpay na nagdilingig, ang bituin at araw niya kailan pa may magdidilim. Lupa ng araw ng walamig pagsinta, buhay ay langit sa piling mo. Aming ligaya na pag may mga atin, at mamatay ng dahil sa'yo.
Please remain standing for a silent prayer. You may now take your seat po. Good morning po uli. It gives me a great pleasure to continue presiding the budget briefing of the Department of Health. Our country has adopted safety measures in compliance with the World Health Organization standard in combating the COVID-19 pandemic. The DOH remain at the forefront of this pandemic since it holds the overall technical authority on health. According to the DOH statistic, 3,375 new cases were added to the total reported cases of 289 nationwide. Accordingly, 208,096 have recovered from COVID-19. Based on the website coronatrackle.com, Philippines is ranked 21st among countries with the most number of total confirmed cases as of September 17, 2020. In addressing the pressing situation brought about by the pandemic, the DOH is aggressively implementing measures to strengthen public safety standards to decrease, if not eradicate, COVID-19 cases. It would be enlightening if we can conclude this budget briefing with the participation and cooperation of the honorable members of this body. Thank you. Vice Chair
Point of
Chua.
order. Madam Chair, point of order. I wish to be recognized.
Madam Chair.
Madam Chair, point of order. I wish to be recognized, Congressman Khalid Dimaporo.
You are recognized, Kong Khalid Dimaporo.
Yes, Madam Chair, for an orderly budget briefing with the Department of Health today, I want to know why our last budget briefing was suspended and if the issues have been resolved. And there needs to be clear guidance from the Chair on how members or for what reason members will suspend budget briefings. Because ideally, this is just a briefing. We're just being presented information by the Department of Health and we're asking questions for clarificatory reasons. If there's any debate, that should be in the plenary. not here during the briefing. So I would like to ask the chair to make it clear to all members on what we're supposed to do in this budget briefing and on what grounds can we suspend the budget briefing for the Department of Health. And it's my hope that we will have a smooth and orderly budget briefing today, and we will not have another suspension for just flippant reasons. If we are not presented the reason why the budget was suspended last meeting and if it was addressed. Thank you, Madam Chair.
Thank you, Congressman Dimaporo. Noted po, itong briefing neto will be continuously po. Hindi na po natin pwedeng isuspend ito. Thank you.
Madam Chair.
Vice Chair Kua, you are recognized. Vice Chair, parang nakamute po kayo.
Okay. I just want to move that we first dispense with the calling of the roll before we start our business. So move, Madam Chair.
There's a motion to dispense with the calling of the roll, duly seconded, and hearing no objection, the motion is carried.
Madam
We
Chair.
would like to acknowledge the member through Zoom. We have 24 members now, and we would like also to welcome our guest from DOH.
Madam Chair, may I manifest, Madam Chair?
You are recognized, Secretary Duque.
Thank you, Madam Chair. May I humbly request that the work that's being done on the rooftop of this structure be stopped because we cannot hear? Thank you, Madam Chair.
Taking care na po, Secretary Duque. Umpisahan na po natin ang interpellation. Unahin po natin ang ating Minority Leader Abante. You are recognized po. Nasa Zoom na po ba kayo? Wala. The next one po is Deputy Speaker El Rey Villafuerte. Nasa Zoom din po ba? The next one is Representative Carlo Zarate. You are recognized. Nasa Zoom po ba? Representative Carlos Zarate, we are waiting for you po. Representative Franz Castro, you are recognized. Nasa Zoom po ba? Representative Franz Castro. Representative Arlene Brosas, you are recognized. Nasa Zoom po ba? Representative Arlene Brosas. Representative Arlene Brosas, we are waiting for you. Representative Khalid Tibaporo, you are recognized.
Even last year, nung pinahuli ko sa Palawan,
Representative Khalid Dimaporo, you are recognized.
Hello?
You are recognized po, Kong Dimaporo.
Madam Chair, before I start and my minutes are counted, I want to make a formal complaint. Whoever the host is not allowing us to unmute ourselves. You have called me 3 times and I've been pressing the unmute button. The host won't let me unmute, and that might have happened to Arlene and some other members. So that needs to be resolved so we can have an orderly meeting. Secondly, Madam Chair, I would like, and I see Arlene Brosses here, and if you want to, Arlene, you want to go first? Kasi your name was called. Or you want me to, ikaw muna?
It's okay. You
Okay po.
first.
Okay, sige. And then, secondly, Madam Chair, my point of order was not answered. I wanted to know why the committee was suspended last budget briefing and if it has been resolved. From what I remember, Congressman Mike Defensor was asking for HFAB funding. And that needs to be shared with the members of the Congress whether or not the HFAB funding has been allocated, equally distributed for the 2021 budget. So please answer if that issue of Congressman Mike Defensor has been settled so that I don't have to ask that during my minutes. Thank you, Madam Chair. This is charged to you, not to me, the minutes.
Okay po, Congressman Dimaporo. I would like to ask Secretary Duque to answer the query of Congressman Dimaporo.
Thank you, Madam Chair and Congressman Dimaporo. Just for the record, the HFAB submitted an original proposal of 45 billion to the National Expenditure Program, or the NEP, for the year 2021. This was the budget which we submitted last June 2020. However, out of the submitted plan, HFAB has only been approved an allocation of 4.7 billion for both equipment and medical transport, and with 5.5 billion for infrastructure projects, which are under the unprogrammed funds, and its release contingent on the sin tax collection of the government. And we have a letter that we have sent to the Honorable Speaker with regard to our additional request. Now, as a consequence of the reduction of the allocation, our goal in the implementation of the COVID-19 responses and the universal health care will be significantly affected, with delays in the functionality, licensing, and accreditation of the needed healthcare facilities due to lack of infrastructure and equipment. May we therefore appeal, just for the record, Madam Chair, for the support of the House of the Representatives in augmenting the approved budget of NEP on the 2021 budget of Health Facilities Enhancement Program, or HFAP, with an additional 10 billion pesos. With the breakdown, we will provide you, Madam Chair, with the breakdown of the 10 billion peso additional augmentation that we are requesting, so as to therefore address the concerns of the several congresspersons about the support they need for infrastructure, for hospitals, for barangay health stations, RHUs, polyclinics, LGU hospitals, DOH hospitals, and other healthcare facilities, as well as military hospitals. Thank you, Madam Chair.
Thank you, Secretary Duque. Please provide us a copy and list para we can also provide that to Kong Dimaporo.
Yes, we will do that, Madam Chair.
Madam Chair, may I request that that copy, that you dictate to the committee secretariat that that copy be made available to all members of Congress, not just to me, but everybody, so we can see it, and we as a group, as an institution, as a body, can lobby in favor of the request of Secretary Duque, Madam Chair.
COMSEC, take note of that. Please provide a copy for every member. Thank you.
I'd like to start my questions now, Madam Chair. And my first question to Secretary Duque, and he knows this, is in regards to the antigen testing guidelines. We know that the WHO has released new policy guidelines which caused DOH to retract their release of the antigen testing guidelines. May I know a timetable or the status of these guidelines, and when can we expect it to be released to the public so LGUs can comply with it? with the guidance of the DOH? Madam Chair, this is my first question.
Madam Chair, in response to the query of...
You are recognized, Secretary Duque.
Thank you very much, Madam Chair. May I seek the permission of the Chair to please recognize USEC Rosette Vergere to answer the question of Deputy Speaker Khalid Dimaporo.
Yusek Rosette, you are recognized.
Yes, good morning, Madam Chair, and good morning to Congressman Dimaporo. With regard to the antigen testing, with the recent guidelines and recommendations provided for by the WHO, wherein it states that they do not recommend the use of antigen test in border screening for mass indiscriminate testing. So with this evidence at hand, the Health Technology Assessment Council of the DOH convened with all of the experts to see how we can revise our pathways based on the WHO recommendations. And it was found that one of the key findings and discussions were that it cannot be used for asymptomatic individuals because of the variability in the sensitivities of these antigen tests that are in the market currently. So the sensitivity is gauged or measured, and the ideal would be at least 80%. But those validated in the market currently it doesn't reach the 80%. And so the experts are kind of hesitant into allowing for us to use this for asymptomatic individuals because of the risk of false negative results. So what has been agreed on in the IATF would be that there would be a pilot use or study that will be done specifically in one city here in the country where it is going to be tried for border screening, but it's going to be used repeatedly or serially tested. So meaning, once an individual goes in or through the border, they will be tested with rapid antigen, and then 3 to 5 days after, they will be tested again, just for us to be sure if they develop the disease or not. Antigen tests are accurate when you find a result which is positive. You do not need to confirm with RT-PCR anymore. But if it is negative, we need to confirm with RT-PCR because, as we say, the sensitivity is quite low, and this is what the experts would like to prove first or confirm by doing this study in one of the cities in the country. So the timeline would be, the protocol is being drafted now, and hopefully in 2 weeks' time, we will be able to complete the study and we will get evidence if it is really appropriate to use antigen test for asymptomatics. Over to you, Madam Chair. Thank you po.
Kong Dimaporo.
Thank you, Madam Chair. My next question is in regards to the UHC. The Department of Health budget has ballooned in the 2020 because of the implementation of the UHC law. And in our last budget briefing, the Department of Health informed the House of Representatives that not all provinces and cities will be recipients of the UHC, but there are selected rollout cities and provinces. I would like to know the number of cities and provinces in 2020. Please place that on record again. And if there has been an increase for 2021 in the number of rollout provinces and cities. My second and follow-up question to that is the budget per city and per province. It can also be submitted if that's the preferred way of answering. Thank you, Madam Chair. That's my second question.
From DOH.
Thank you, Madam Chair. There has been an increase in the integration sites under the Universal Healthcare Law, and we've increased this to 58 provinces and highly urbanized cities. And I'd like to request the chair to please recognize Yusek Villaverde for more complete answer to the question.
Yusek Villaverde, you are now recognized.
Thank you, Madam Chair. Now, just to elaborate some of what the Secretary has said, right now we have 58 UHC integration sites. These were based on the criteria of the LGU's willingness to be part of this integration of our local health system, as well as their readiness to immediately implement our Universal Healthcare Act. So each region has screened several LGUs who can be already engaged in the universal healthcare implementation, and right now the list has not changed since last year because of the COVID-19 response. There were some delay in terms of engaging our local governments. Now, we also have some specifics when it comes to some assistance for these local government units to start their integration process. And we can provide the House of Representatives this list, as well as the corresponding assistance that we will be providing. Thank you, Madam Chair.
Madam Chair, I'd appreciate if the information can be submitted to the committee secretariat, but I want to place on the record from the DOH how much was released in 2020 for the universal healthcare coverage to LGUs, directly to LGUs, under the 2020 budget, and how much are we expecting to release directly to the LGUs for the 2021 budget under the UHC project law?
Yusek Villaverde.
Yep, yes po. Madam Chair, we will just submit because we have a list here, but I have to find it in my files.
Madam Chair, may I be recognized? I don't want the DOH to have a hard time with me, and I will allow them to submit if need be. But I just need to make it public so the Secretary can hear me. And that is, I believe that Lanao del Norte is one of the recipients of the UHC law. And we are already, ever since 2007, when he was secretary under a previous administration, we have been allocating 20% of our ERA to healthcare to our hospitals. And as of now, roughly 200 million is set aside every year to run our hospitals. Whatever the DOH requests from the province of Lanao del Norte, the capital will comply so that we can comply with the UHC law. However, under the 2020 experience, all that the DOH has been requesting from us are sangguniang panlalawigan resolutions and an augmentation or a change in our plantilla to recompose our provincial health board. I think that falls short on what is expected from the law. And I hope our DOH secretary can address it so the people can feel, how good the UHC law is. But for 2020, and we understand because of COVID, we really don't feel it. There's really no additional assistance. We hope that in 2021, that type of assistance will come. Can I at least get feedback from our secretary?
Before I recognize Secretary Duque,
Thank you, Madam
Kong
Chair.
Dimaporo,
Certainly,
that will be
we-
your last question na po. Okay, you are recognized, Secretary Duque.
Thank you, Madam Chair. Certainly, we are committed to support the various LGUs who have committed to integrate their local health systems. But I would like to commend, in fact, Congressman Dimaporo for being one of the provinces that came up with its comprehensive provincial investment plan for health. So this is the plan for the health development of his province, and we continue to support that, and we will support it for 2021 and 2022. For as long as the plan is clear and a complementation of resources is in order, so that the plan can be realized. So yes, the commitment is there, Madam Chair, for 2021.
Thank you, Secretary Duque, and thank you, Madam Chair, for allowing me to ask questions. And if you don't mind, I would like to submit to the committee secretary further data that I'm requesting from the Department of Health, and I hope you will facilitate that. Thank you, Madam Chair.
Okay po, Kong Dimaporo. Thank you. Now, the next one is Representative Arlene Brosas. You are recognized.
Thank you, Madam Chair. Madam Chair, can I be heard dyan?
Opo.
Thank you. Madam Chair, I have a few questions for the Secretary. Madam Chair, si Mr. Secretary, kayo po ang Head of Board of Trustees ng PhilHealth, right? Lahat po ng decisions, importanteng policies, patakaran, decision, kaugnay sa PhilHealth, dumaraan sa inyo. Tama po ba, Madam Chair, Mr.
Secretary Duque, please answer.
Ako po, tama po kayo, Madam Chair. I am one of the 13 members of the Board of Directors of PhilHealth, and the board is a collegial body. And in fact, among the members of the board, it is only the chairman who does not have a voting right, based on the Universal Healthcare Law of 2019, which Congress passed and signed by the President, where clearly the chairman has been not voting, made a non-voting member. And secondly, all the decisions of the board are arrived at through the collegiality. So wala pong isang nagdidesisyon lang, lahat po ito ay pinagdidiskusyon at pinagdidebatihan, at kapag nagkaroon ng kasunduan, at saka lang po magkakaroon ng karampatang resolution to address whatever gaps there are in the management of the National Health Insurance Program. So yun lang po masasabi ko, Madam Chair.
Madam Chair, kung ganun po, yung kasama po kayo sa nag-approve ng interim reimbursement mechanism, yung IRM. Kasi po, yan ang tanong ng mga kababayan natin ngayon, yung mga ordinaryong mamamayan, sa hinaba-haba ng pagdinig sa Kongreso ng corruption sa PhilHealth, ang tanong ng mga mamamayan natin, ano nang nangyari doon sa IRM? No? Kaya kasama po kayong nag-approve nito. Right, Mr. Secretary, Madam Chair?
Madam Chair, with your permission, hindi po ako nakasama. Wala po akong pirma, at ako po ay absent for almost 4 months sa PhilHealth board meetings, sapagkat nung nagdeklara po ng state of public health emergency si Pangulong Duterte, bunsod ng ating pandemic COVID-19, ay ang panahon ko po ay halos naubos sa pagiging tagapangulo o chairperson ng Interagency Task Force, which consists of 33 national government agencies, and we were meeting every other day for at least on the average 10 hours every other day sa kasagsagan po ng ating COVID-19. At pangalawa po ay batay ho sa batas, ang Vice Chair ng PhilHealth Board ay ang President and CEO. At ako naman po, malaki po ang tiwala ko na ang President and CEO na siya po iniluklok ni Pangulong Duterte na siya po ang magpapaganap ng mga meetings ng PhilHealth Board. So, hindi po ako kasama. Makikita po natin, I can give you the resolution that shows that wala po ako, hindi po ako nakasama. Salamat po, Madam Chair.
Madam Chair, tinatanong po natin ito dahil gusto nating malaman at alam ko naman na alam dapat ng ating chairman ng Board of Trustees ng PhilHealth na kung ano, aware siya kung ano ang nangyari na corruption sa PhilHealth. Kasi may mga accusation ng 15 billion. Halimbawa, ang very specific po na gusto nating malaman, ano nang nangyari doon sa 15 billion. Tapos nasaan ang buong liquidation ng IRM. Hindi naman po pwede na maghugas kamay yung ating DOH secretary na dahil busy siya dito ay hindi siya aware dun sa nangyayari na paglustay ng pera ng mga officials sa PhilHealth. Madam Chair, Mr. Secretary.
Secretary Duque.
Maraming salamat po. Sinuspindi ko po, pinasuspindi po ng board ang interim reimbursement mechanism dahil nga po may mga issues na dapat pang lutasin. Ito po yung liquidation, number 1. Number 2, yung kanilang aligasyon na may palakasan daw sa pag-distribute ng interim reimbursement funds. Tapos yung pong withholding tax at yung legal basis. At sabi ko, hanggat hindi malinaw po ito, ay hindi pwedeng ipagpatuloy itong IRM bagkos yung usual reimbursement mechanism must continue. So, ito naman pong issue na ito is a subject of an investigation by the disciplining authorities. Kasama po dyan ang binuo ni Pangulong Duterte, yung Task Force PhilHealth, para po tugunan itong mga issues na ito. At ang DOJ po ang nangunguna sa investigation na inumpisahan 30 days ago. So, yan lang po masasabi ko ngayon at inaalam pa ho ito at suffice it to say na pinasuspindi po natin ang implementation nito hanggat yung liquidation issue ma-resolve, yung tinatanong na legal basis ma-resolve, yung sinasabing palakasan ma-resolve, at saka yung pong withholding tax. So, yan po ay patuloy na tinutugunan po ng PhilHealth. Salamat po, Madam Chair.
Madam Chair, meron ba o wala na liquidation na ng IRM?
Meron na po, pero ang PhilHealth, andito po, with the permission of the Chair, can I ask SVP Neri Santiago to please give the complete response to the question.
SVP Santiago, you are recognized.
Good morning, Madam Chair. Good morning, Congresswoman. So far po, ang liquidated na po na amount out of the 14.9 billion ay almost 5 billion na po, which is 33% of the released IRM po.
Madam Chair, can we have a copy na lang nung kanilang report na yan, na 5 billion na kanilang na-liquidate na, Madam Chair? Then, Madam Chair, kaugnay dito, gusto nating tanungin yung sinabi kasi noon na ang PhilHealth hanggang 2021 na lang daw yung buhay ng pondo ng mga miyembro. Pero hindi po nito pinaliwanag kung ano ang status ng 97 billion reserve funds at 149 billion investment portfolio kabilang yung investment sa corporate bonds at stock market. Ngayon, tanong po natin dito, ano yung status ng breakdown ng 149 billion investment portfolio? Magkano na po ito sa kasalukuyan, saan-saang kumpanya po at nagpautang at ininvest ito, at ano na pong nangyari sa kanila, ano na yung status nila, nalugi ba ito, considering na bumagsak ang ekonomiya, kung nalugi, magkano po yung naging pagkalugi, yun po yung mga kailangan natin itanong. Madam Chair.
SVP Del Rosario, please respond.
Thank you, Madam Chair. Thank you, Congresswoman. Tungkol po dun sa pondo po na hanggang 2021 po, ito po ay depende po sa mga assumptions that we have incorporated within the projections. So meron po tayong iba-ibang scenarios na tinitingnan, depende po sa magiging labas ng pagbabayad natin or kakailanganin nating bayaran para sa mga COVID cases and the COVID testing. So far po, as of July, we have 109 billion in terms of reserve funds. And ang investable po dito ay mga nasa 200 billion. We can give you the breakdown po in terms of investment kung saan po naka-invest itong investable funds. So sa ngayon po, medyo mabagal po kasi ang pasok ng claims dahil sa ating pinalabas na polisiya na they are allowed to, the hospitals are allowed to submit 120 days after discharge. Kaya po ang pasok po ng mga claims information ay medyo mabagal po. So, hindi pa po ma-ascertain kung gaano po ang i-realize pagdating po sa projections. So, sa ngayon po, meron pa po tayong ipambabayad sa mga ating benefit payouts. And so far po, liquid pa naman po ang ating pondo.
Okay, Madam Chair, kaya po natin yan tinatanong kasi...
Kong Arlene,
yes.
last question na po.
Yes, Madam Chair, tinanong po natin yan kasi ang dami pong investment schemes ng PhilHealth. Tapos hindi natin nalalaman kung ano yung report nito at bahagi po ito ng corporatization of the healthcare system na sa tingin po namin nagbibigay ng vulnerable lalo na kalagayan kaya nagpapatuloy yung corruption. Imagine niyo po 149 billion investment portfolio, 97 billion reserve funds, tapos after 2 years lang sa panunungkulan pa ni Duterte, sa administration ni Duterte, makakarinig tayo ng pangamban na nawawala na yung pera. And medyo ang hirap pong isipin na may corruption sa PhilHealth, no? Sumabay pa dito sa failed pandemic response na nga ng gobyerno na ito, no? Kaya po kami, no, nananawagan na sana yung budget ay idiretso na lang sa mga pampublikong ospital para sigurado tayong hindi mabubulsa ng mga corrupt na opisyal, Madam Chair. That's my last, Madam Chair. Hingi na lang po ako ng net income ng PhilHealth mula sa premium hikes at saka yung 2020, magkano ang benefit payments na nirelease ng PhilHealth, Madam Chair.
SVP Del Rosario, please respond.
Thank you po, Madam Chair, Congresswoman. We will provide po yung information na nire-request po ninyo. Thank you po, Madam Chair.
Reminder lang po kay SVP, please submit the list of ang liquidation for 5 billion and investment funds po.
Will do po, Madam Chair.
The next one is Vice Chair Juni Kua. You are recognized.
Thank you so much, Madam Chairperson. Maiksi lang po ang aking bagay na tatalakayin kay Secretary. Dalawang bagay lang po. Una, tungkol po sa bakuna para sa COVID-19. Pangalawa po, yung kahalagahan ng HFAB. At tungkol po dun sa bakuna, ano po ba ang latest na balita tungkol dito sa bakuna? Kailan po ba tayo magkakaroon? At kung tayo ay magkaroon, ang pamahalaan ba ay nakahanda sa malawakang pagbabakuna? Sufficiente ba ang ating logistics? Lalong-lalo na yung, I was informed, yung cold storage facilities. Yan po ang isang una kong tanong, Madam Chair.
Secretary Duque.
Sa kasalukuyan po, Madam Chair, meron pong pakikipag-ugnayan ang Department of Health, kasama po ang Department of Science and Technology or DOST, kasama din po ang ating Health Technology Assessment Council at ang FDA At ito po pinag-aaralan yung mga iba't ibang mga bakuna na kung saan nagkaroon po ng mga kinatawan na nagsumite ng tinatawag na confidentiality disclosure agreement para bago po sila makapagbigay ng mga impormasyon dahil nga humihingi tayo ng mga karagdagan kaalaman at impormasyon tungkol sa mga iba't ibang bakuna dahil marami po ngayon sa clinical trial phase 3 ang mga maraming mga bakuna. Meron po rito 3 galing sa China, Sinovac, Sinopharm, sa Wuhan at saka sa Beijing. Tapos meron din po tayo sa Adimmune sa Taiwan. Meron din po tayo sa AstraZeneca with Oxford. And we also have one from Pfizer together with BioNTech. And also the Sputnik 5 from the Gamaleya of Russia. Yung pong Pfizer sa Amerika po yun at saka yung AstraZeneca sa UK. So ilan po ito sa mga pangunahin mga kilalang vaccine manufacturing companies na sila po ay meron ng isinumite at pumirma po tayo dun sa non-disclosure confidentiality disclosure agreement para nang sa ganon mas kumpleto po ang impormasyon at doon magabayan tayo sa ano bang gagawin desisyon ng national government. Pero ang with your permission, Madam Chair, si Yusek Vergeri po ay handa rin magbigay ng updates patungkol po sa ating vaccine status.
Yusek Rosette, you are recognized.
Yes, good morning again, Madam Chair, and good morning po, Honorable Congressman. As to the COVID-19 vaccines, katulad po ng sinabi ni Secretary Duque, ang atin pong gobyerno through the Department of Science and Technology and of course the Department of Health are having these negotiations and discussions with different governments who are offering their assistance to the Philippine government and also manufacturers po. Nakikipag-usap tayo. What we have right now, unang-una po, meron po tayong WHO Solidarity Trial for Vaccines kung saan pipili po ang WHO ng ilan sa mga bakunang nasa advanced stages na all over the world at isasama po ito dito sa clinical trial na ito. Kasali po dito ang Pilipinas at ang kanilang mga bakuna na isasama dito, pati po yung mga sites na pipiliin po nila dito sa Pilipinas, ay i-announce na po nila bago po matapos ang September. And all the documents are being finalized and hopefully, ang sabi po nila, baka makapag-umpisa na ang clinical trial ng WHO bago po matapos ang Oktubre. So that would be 3rd to 4th week of October. Yun pong mga ibang bakuna, katulad po nung sa Russian Federation, yun pong Sputnik V, nakikipag-usap pong maigi ang ating gobyerno sa gobyerno po ng Russia, nakapagbigay na po ng initial na mga technical documents, naaral na po ng vaccine experts panel natin, yun pong mga documents ng Sputnik V na bakuna. Kausap po namin sila nung isang araw at ang sabi nila mag-uumpisa na po ang kanilang formal phase 3 clinical trial na would involve 40,000 citizens from Russia. Dito po sa Pilipinas, yun din po ang ating ninegotiate na makapag-clinical trial din ang Sputnik V dito po sa ating bansa. As to the other vaccines, yun pong sinabi po ni Secretary Duque na mga Sinovac, Sinopharm, ito po ay meron na tayo mga kasunduan which we call confidentiality disclosure agreement na nakasaad po dyan kung ano po yung mga impormasyon na maaari lang nating i-release or i-disseminate at pag-aralan base po sa agreement na yan at pagkatapos po niyan magkakaroon na po ng process. So lahat po ng bakuna na inaalok sa atin ay dadaan sa regulatory process natin. Mag-uumpisa po yan sa pagsasabit nila sa atin ng kanilang dokumento kung saan ang vaccine expert panel po ng Department of Science and Technology pinag-aaralan po yan. Pagkatapos, the ethics review will be done. Pagtapos na po at pumasa na sa vaccine expert panel at saka sa ethics review, saka po napupunta sa Food and Drug Administration for the final clearance. So lahat po nitong prosesong ito, i-undertake natin We are just trying to finalize negotiations with the different manufacturers and also other countries that we are partnering with. Magbibigay po tayo ng further information kapag nakumpleto na po lahat ng pag-uusap. Madam Chair and Mr. Secretary, if Yusek Mir Nakabutahe can explain about the budget for these vaccines, Madam Chair.
Yusek Kabutahe, you are now recognized.
Thank you, Madam Chair. Good morning, Congressman Kua. In terms of the budget po ng COVID vaccine, for 2020 po, naglaan po tayo ng 2.5 billion para makover po yung ating most at-risk population. Sino po ang mga ito? Yung ating medical frontliners, yung ating barangay health workers, yung ating indigent senior citizen. Tapos meron pong classification yan. Pero ang total na kailangan po natin ay 12.9 billion. Pinag-uusapan po na 2.5 billion muna ang i-propose dito sa 2021 kasi po may scheme na pinag-uusapan na pwede hong mag-loan sa land bank. Tapos po, para ma-cover yung remaining na nangangailangan ng mga bakuna, kasi po ang utos ng ating presidente, kailangan mabakunahan 20 million people for once the vaccine is available. Paano po yung pinag-uusapan na mechanism? Ito po, may uutang tayo sa land bank, magpo-purchase po yung ating tinatawag na PITC Pharma ng DTI. Tapos po, ang pagbayad, para siya ang bibili ng vaccine, ang pagbayad po, kukunin ho sa budget ng DOH in the coming years. So yan po ang estado ng ating proposal for the vaccine procurement. Thank you, Madam Chair.
Madam
Vice
Chair,
Chair Kua.
may continue. Madam Chair, ang narinig ko po, ang mababakunahan na instruction ng ating Pangulo ay 2 million lamang, 20 million lamang. So, ang ibig sabihin, yung iba ay hindi na gobyerno ang magpopondo, kundi private sector na ba? Ganun ba yun?
Yusek Kabutahe.
Yes, Madam Chair. Yes, Congressman Kua. Hindi ho natin babakunahan lahat. Ang una pong sinasaalang-alang natin, pati po yung mapuproduce na vaccine next year may not be able to cover the global demands. Pero tama po si Congressman Kua na pwede po through the private sector. Nakikipag-usap din po ang ating mga different suppliers with the sub-TWG on vaccine development. Kasi meron mga gustong maggawa ng trial o yung kahit hindi man gumawa ng trial, gusto nilang magtinda na ng bakuna. And we are developing the processes paano sila dadaan sa FDA. It will be through the private sector. Kung meron mga bakuna pong that will be available and past our regulatory requirements. Maraming salamat po.
Vice Chair Kua.
Madam Chair, ang ibig sabihin nito, ang private sector ay libre rin na mag-import at magbenta sa mga private para makapagbakuna rin. Na ang pangalawang tanong ko po tungkol sa bakuna, yung pong ating capability to distribute this. Meron ba tayong kakayahan, lalo na yung storage facility? Balita ko, special storage facility ang kailangan.
Yusek Kabutahe.
Thank you, Mr. Chair. Yes, we will use our current cold chain facilities po na ginagamit sa regular immunization programs. Pero tinitignan po natin kasi hindi po natin alam yung ating vaccine kung multi-dose ba siya o isang dose. But we are proposing to look at possible additional hubs kung saan pwedeng ilagay itong mga bakuna. In terms of distribution po, meron ding utos po ang ating presidente that it will be together with the PNP and the AFP who will help us distribute and implement the program para mas mabilis. Kasi po ang mga target natin ay mga adult population. So magtutulungan po ang DOH, ang mga local government, tapos mga PNP, AFP, para ho i-distribute at maibigay sa mga kaukulang target yung ating mga bakuna. Maraming salamat po.
Paano naman po nating ma-motivate ang private sector para yung private sector makatulong ng gusto?
If I may.
Secretary Duque.
Ang pribadong sektor naman po ay may mga grupo din po yan, mga chambers of commerce, no? Meron na po silang mga sariling mga pamamaraan para siguraduhin na yung demand ng private sector ay matugunan po nila. Pero sa bandang huli, bago ang lahat ng ito, ay dapat siguraduhin po natin na talagang ligtas, that the vaccines that will be imported are in accordance with the stringent standards of safety, efficacy, and quality. So kaya dadaan po ito sa FDA kung may mga mag-aangkat na mga pribadong kumpanya na mga bakunang ito, ay dadaan talaga po sa regulatory processes ng ating pong FDA. So yun lang po masasabi natin sa ngayon. At siguro ulitin ko lang, Chair and Congressman Kuwa, na ang pakikipag-ugnayan natin tuloy-tuloy, pero hindi rin kasi makapagbigay ng sapat na impormasyon. Ang problema natin ngayon, we don't have sufficient information upon which we can make decisions, at least by the government. So that is why that confidentiality disclosure agreement is so important, because that will now pave the way for these companies to provide the needed information, the technical information, the logistical support information or requirement to carry out this COVID-19 immunization program. Salamat po, Madam Chair.
Madam Chair, sana po mapag-aralan mabuti yung problema ng storage, kasi ang balita ko po, baka ito ang maging bottleneck sa maayos na implementasyon. May I go to another topic, Madam Chair?
Vice Chair, na-consume nyo na po yung 3 minutes?
Hindi pa po, 2 minutes. 2 minutes pa lang po. Hello? I just want to wrap up. Hello? Hello?
Okay po, Vice Chair.
Gusto ko lang pong magpasalamat kay Secretary Duque sa kanyang suporta sa aming probinsya, lalo na doon sa aming hospital. Now, ang isang programa ng DOH na talagang nakakatulong ay yung HFAB. Yung po bang HFAB, pinalalakas ba natin by way of infusing more funds or nare-restrict ang ating funding sa HFAB?
Secretary Duque.
Salamat po. With the permission of the chair, si Yusek David can respond to this.
Yusek David, you are recognized.
Maraming salamat po, Madam Chair at Congressman Kuwa. So maraming salamat po na kinikilala nyo na mahalaga po yung ating HFAB, kasi tunay po na madami po tayong kailangang isagawa sa ating healthcare service network, simula po sa hospital at saka sa ating mga rural health centers, at pati na rin po yung ating barangay health station na yun ho yung na-access ng ating mga pamilya na malapit sa kanila. So, bumaba po yung budget ng Health Facilities Enhancement Program na nakalagay sa National Expenditure Program for 2021. Kaya nga po si Secretary Duque ay nagpapasalamat po sa Kongreso na kung sana po maitaas natin yung budget ng Health Facilities Enhancement Program for 2021 na kahit ma-increase lang po natin ng 10 billion para ho mapunuhan natin yung kailangan ng universal healthcare at saka din ho sa ating COVID response. Maraming salamat po.
Okay, so Madam Chair, I'd like to express my sincerest thanks to Secretary Duque and the DOH family for their support to our health program. And I would like really to support the increase in the budget of the HFAB. At even in our district, in our province, we really need their help to modernize our facilities. So on that note, Madam Chair, maraming salamat po sa ating DOH family.
Salamat din po kay Congressman Juni Cua, Madam Chair.
Thank you, Vice Chair Cua. May additional question lang po ako kay Yusek Cruzet. Gaano po katagal ang proseso ng paglabas ng bakuna? Kasi dadaan pa ito sa vaccine specialist natin, dadaan pa ng DFA. Gaano po ito katagal bago maging lumabas sa public na pwede nang gamitin?
Yes, Madam Chair, yun pong regulatory process. Ito po ay napag-usapan dun sa ating Sub-Technical Working Group for Vaccine Development headed by the Department of Science and Technology na nagkaroon po tayo ng pag-uusap para paikliin yung number of days that the regulatory process can be undertaken and it can be final. So from dati po, sa mga bagong teknolohiya, ang FDA would have around 290 plus days to process. Pero ngayon, mapapaikli po natin ito mga pag-approve ng clinical trial from the time that the experts review this. Pagkatapos po dun sa Ethics Committee, pagkatapos FDA, they have identified 44 days para po matapos ang proseso na ito. Pero ito naman ang sinasabi din po ng ating mga eksperto at ng FDA, kung kumpleto naman lahat ng requirements and everything has been complied with, maaring umikli pa itong 44 days na ito.
Ganun ho pala katagal. So probably next year pa natin tayo magkakaroon ng vaccine?
Madam Chair, if I may. Base po dun sa huling pag-uusap, ang atin pong tinitignan would be parallel activities para mapabilis po natin ang pag-aaproba nitong mga clinical trials. So kung ano po yung pwede na nating gawin sa ngayon in preparation para pagdating po nung talagang documents at tapos na po yung protocol, maari na po nating mas mapabilis ang ating mga proseso. The WHO Solidarity Trial for Vaccines, mag-umpisa na ho siya, ang sabi ng WHO, about 3rd or 4th week of October of this year. So ito ho baka ito po ang mauna. And there are also individual clinical trials from specific manufacturers na nag-a-apply na po ngayon sa FDA for their clinical trials.
Upon the approval po ng FDA, gaano katagal yun?
Ma'am, I did not hear. I'm sorry.
Gaano po katagal para maaprubahan ng FDA yung vaccine? Kasi minsan sa kanila nagtatagal eh.
Opo, pero for this, because we are expediting everything, the Food and Drug Administration has committed to shorten the process when it comes to clinical trials. Pero yun pong bakuna na papasok dito na hindi na magki-clinical trial at magkakaroon na lang po ng pagre-rehistro dahil gagamitin na, pwede nang gamitin sa merkado, ito po yung kailangang pag-usapan pa, no? How we can further expedite the process para po mas mabilis pong lumalabas ang mga produkto as long as they have evaluated that it is safe and efficacious for the population.
Thank you po, Yusek Cruzet. Pwede ko po bang matanong ang DBM, si Director Mary Ann de la Vega, kung bakit lumiit ang budget ng HFAB? Director Mary Ann de la Vega, nasa Zoom po ba?
Good morning po. Good morning po, Madam Chair. Ang HFAB po, ang annual na binibigay po natin sa HFEP, depende po siya kung ano ho ang nagiging available sa HFEP based po dun sa ating level na siniset for spending for a certain year. So, as far as HFEP is concerned, tinitingnan din po namin kung ano ho yung naging accomplishment niya. So, for the past years ho kasi, tinitingnan natin yung medyo dismal na performance as far as HFEP is concerned. Like for example, for cumulative starting 2008 na accomplishment ng HFEP, out of the 145 billion na releases made to HFEP, about 74% of that or 108 billion has been obligated. And as far as disbursement is concerned, our records show that only 56% of the allotment provided to them has been disbursed. So, meaning po, ang translation po nun sa amin, yun ho yung actual na na-accomplish. We, in crafting the budget level of each department, we make due consideration on the absorptive capacity of the different departments. So medyo malaking factor po 'yon na despite the amounts given to DOH for the HFAP, medyo mabagal po yung implementation, yung physical accomplishment nila. So we have advised and we have been doing this, I think we started noong 2018 when we were crafting the 2019 budget na we asked DOH to really cleanse yung HFAP and to go over each yung various years nila, yung previous years nila. Kasi po medyo may nakikita kami na if there are some projects there na hindi na ho talaga siya gagalawin, hindi na ho talaga siya mai-implement, it's time that they cleanse their books at talagang i-declare na hindi na to itutuloy so that they can do proper programming of the amounts which are being made available to them. So, ongoing naman po yung process namin. We are in continuous discussion with the DOH as far as the HFAP is concerned. That's why we also made sure that there is a 50 million monitoring fund given to HFAP purposely to do monitoring sa cleansing noong mga sub-projects under the HFAP. What we are doing is to really maximize and we're asking actually the DOH to really prioritize ano po yung mga sub-projects na ginagawa sa HFAP because of the due consideration na maliit po talaga yung ating fiscal space as far as additional projects are concerned. So the amount given to HFAP, so meron po tayong nakaprogram sa kanilang budget mismo, 4 billion plus given to them, as well as the 5.5 billion under the unprogrammed fund. It's being submitted to the Congress for your wisdom po, Madam Chair, and in recognition of the power of the purse of the Congress. Thank you, Madam Chair.
Thank you po. The next one is Representative Sara Ilago. You are recognized. Representative Sara Ilago. Representative Sara Ilago, we are waiting for you. Representative Sara, go ahead. You are recognized. Representative Sara Ilago. The next one to interpolate is Representative Eupemia Kulamat. You are recognized.
Hello, Madam Chair.
Okay po. You are now recognized, Kong Eupemia.
Maraming salamat, Madam Chair, at magandang umaga sa lahat. No? Madam Chair, ang tanong ko po, Madam Chair, ay hinggil po sa hinggil pa rin sa COVID-19. Madam Chair, ang tanong ko po dito ay libre po ba ang pag-test ng COVID-19 para sa lahat o lang sa mga may sintomas? Hello?
Secretary Duque, please answer.
Okay, magandang umaga po, Congresswoman and Madam Chair. Yung pong testing, basta't sang-ayon po doon sa atin tinatawag na expanded testing guidelines na meron po tayong 10 subgroups na papaliwanag po mamaya ni Yusek Vergere. Ito po ay masasakupan ng PhilHealth reimbursement. Meron pong 3 fees na depende kung ano yung mga conditions, no? Doon sa testing meron pong 3,409 kung lahat po nung sasagutin ng laboratory yung pong gastusin para maisagawa yung testing. Tapos yung susunod pong level na babayaran ng PhilHealth after 3,409 is 2,077. Ibig po sabihin dito, meron pong kasamang donated kits from the DOH doon po sa laboratory na magsasagawa po ng test. At daan naman po sa pangatlong level of fees na babayaran o sasakupan ng PhilHealth, 901 pesos. 901 pesos. Kung ang nagsasubsidize po naman para sa operation ng testing lab ay ang gobyerno. So siguro yun lang, sino-sino po yung masasakupan ay pwedeng sagutin po, madalian lang po ni Yusek Vergere. Thank you, Madam Chair.
Kong Eupemia.
paano kung hindi bayad sa PhilHealth o contribution? Mr. Chair, Madam Chair.
Kong Eupemia, pwede pong pakiulit.
Ang tanong ko, libre ba? Paano kung hindi bayad sa PhilHealth o contribution? Libre ba ito? Ang tanong ko kasi, libre ba itong ganito? Kasi halimbawa, ito kasi yung kahirapan ng mga kababayan natin na mahirap na nga kasi pandemya ngayon, walang mga trabaho at hindi sila, ito yung dahilan kung bakit hindi sila makakapag-test dahil wala silang pambayad.
Yusek Rosette.
Yes, Madam Chair,
Madam
and
Chair.
good morning po, Congresswoman. Unang-una po, libre naman po yung ating pagbabakuna, lalo na kung ay pagtetest for COVID-19, lalo na kung kasama po kayo dun sa sinasabi nating expanded testing protocol. Ito pong expanded testing, bukod po dun sa mga priorities natin dati na may mga simptomas, may mga exposure, sinama na rin po natin yung mga high-risk subsectors natin, katulad po ng mga market vendors, factory workers, security guards, nakalagay po yan lahat sa protocol natin. So kapag ka pumapasok po ang isang subsector or individual dito sa protocol na ito, definitely covered po siya ng PhilHealth. Kasi po ang PhilHealth, they align to our protocols kung sino po yung dapat na mabe-benefitan o mare-reimburse or mapapasok sa coverage ng testing guidelines ng PhilHealth. So, pag tinignan ho natin yan, libre po yan, lalong-lalo na kung pumunta kayo sa gobyernong facility natin, kung hindi man kayo kasama sa subsector na yan, but it's a government facility, it is for free because government subsidizes the testing kits and the other logistical requirements for our government laboratories.
Madam Chair, papadalahan po namin ng testing guidelines ang Secretariat.
Okay, you are recognized.
Thank you, ma'am. Padadalahan po namin ang ating pong butihin kinatawan ng ating pong expanded testing protocol para magabayan po sila kung sino po ang masasakupan ng libreng testing.
Congresswoman Eufemia.
Madam Chair, Madam Chair, kaya ko po itinanong ng pinatawang ito dahil mandato po kasi ng departamentong ito ang tiyakin ang serbisyo para sa lahat ng mamamayan at dapat may ginagawa para ilipat ang ilapit sa mga mamamayan ang serbisyo, lalo na doon sa amin po kasing karanasan, Madam Chair, na matagal na panahon na hindi umabot ang mga batayang serbisyong medikal sa liblib na mga lugar o probinsya, lalo na sa amin ng mga katutubong komunidad. Tuloy na dumadaming kaso ng COVID, lalo na sa pag-uwi ng marami sa probinsya. Dapat matugunan ang pangangailangan ng testing para hindi kumalat pa ang COVID, lalo na sa mga vulnerable mga komunidad. Ito lamang po, Madam Chair, ang aking katanungan at manifestasyon. Maraming salamat at magandang umaga ulit.
Maraming salamat po, Congresswoman Eufemia. Ang susunod pong magtatanong, si Deputy Speaker Ferdinand Hernandez. Deputy Ferdinand Hernandez, nasa Zoom po ba?
Yes. Good morning po.
Good morning po. You are now recognized.
Good morning, Madam Chair. Question to Secretary Duque. I think, Secretary Duque, we've discussed the turnover of the Surgeon General Hospital. May get an update kung ano na po yung napag-usapan niyo with your your staff regarding the turnover of the Surgeon General Hospital.
Secretary Duque.
Well, ang latest po, ang panayam ang atin pong Yusek Abdullah Dumama with the DILG for the implementation of the turnover. Despite the signed MOA, but that is my instruction to the Undersecretary to implement this together with the DILG's assistance.
Thank you, Mr. Chair. No? Kasi yung turnover, hindi lang naman because meron na tayong batas ngayon. Meron din Regional Development Council resolution ang Region 12 na i-turn over na. At the same time, yung Committee of Health at saka yung Public Accounts nagkaroon din ng joint resolution nung nakaraan na suportahan yung immediate turnover nitong bagong regional hospital. I think si Undersecretary Vega na nandyan ho can also siguro attest and comment how urgent itong request na kailangan ng ma-turnover because this is the second budget na diniscuss natin ito na in fact hinabol natin last budget na magkaroon ng MOE, PS at I think there's a 46 or 48 million na nailaan dito and January 15 yung deadline for turnover. So pwede ko bang hingin yung opinion at ni ni Undersecretary Vega regarding yung immediate na turnover kasi we are quite dependent on SPMC, not on the Cotabato Regional Hospital. Madam Chair, pwede mo bang mag-comment si Yusek Vega since galing siya sa SPMC?
Yusek Vega, you are now recognized.
Madam Chair, this is to answer Congressman Hernandez. First of all, I have already talked with the regional director of Region 12, si Dr. Aristides Tan, and we were on the agreement that there has to be turnover of the hospital for the renationalization because I think it is most important that there will be a facility that can cater to the constituents in South Cotabato. So if we can, I think with the MOA and with the direction of the Department of Health, because it has already signed and together with the local government, I think it is imperative on us that we need to make this, implement the renationalization of the South Cotabato hospital at once. I think that's my view, Madam Chair.
Okay, Madam Chair, for the information of Secretary Duque, I think yesterday, IATF was in General Santos, no, si General Galvez, si Vince Dixon, and I think even Secretary Lorenzana. And they also discussed this, and I think I don't know if they were able to also talk to Yusek Berhere, no, regarding this na kailangan ng immediate because magkakaroon na, in fact, health crisis na nga to because yung mga hospital dito puno na, nagkaroon ng surge, and we are quite dependent on testing on a private hospital. Wala kaming government hospital even in here in South Cotabato. So may I ask DOH, what is the plan? Is there a plan to put up a COVID lab in SGH to cater to Region 12? Kasi region ang pinag-uusapan, hindi lang naman province of South Cotabato.
DOH.
Madam Chair, permission to recognize Yusek Bergere, head of the Health Regulations team.
Yusek Rosette, you are now recognized.
Yes, again, Madam Chair, good morning po. Good morning po, Congressman Hernandez, I'm sorry. Currently po, meron po tayong 5 lisensyadong laboratorio sa Region 12. And of course, we would like to provide further access, no, dito po sa ating areas, especially in the areas of Mindanao, specific Region 12 po. So ngayon po, may mga applications pa rin tayo, tinutulungan po natin, no, ang ating mga laboratorio so that they can have this facilitated licensing process para po magkaroon pa ng additional laboratories. So kung meron pa rin po kayong nire-recommenda na facility that should be licensed para po mas magkaroon ng access, you can just advise us, sir, so that maipamadali natin ang paglilisensya at pag-accredit para po magkaroon pa ng mas madaming laboratorio sa lugar.
Well, thank you, Madam Chair. No, let me comment. Considering that, assuming that there will be turnover of SGH as a regional hospital, di kailangan may budget yan this year na kailangan magtayo ng COVID laboratory dyan. Kasi, very immediate yung need, and so we will not be dependent on private hospital. Remember, ang bawat swab is 6,000 pesos. Now, I don't think anybody can just go to a private hospital, magpapaswab ka kung wala kang pera. Samantalang kung government hospital yan, kung regional, di kahit paano makakalibre siya o merong support from the national government. So, kanina Secretary Duque, since iti-turn over yung SGH, kailangan na budgetan ng DOH kasi magiging national yan, na magkaroon ng COVID laboratory for Region 12.
Secretary Duque.
Maraming salamat, Madam Chair. Yung pong sinasabi ni Kong Dinand na kinakailangan suportahan by way of establishing a biomolecular lab in the Soxergen General Hospital ay susuportahan po natin itong kanyang mungkahi at ito naman po kung mga equipment, meron po naman tayong nakalaan na budget na 4.7 billion for 2021 at maisasama po natin itong mga biomolecular laboratory equipment and also titingnan po natin depending on the outcome of our evaluation or assessment of the laboratory kung kinakailangan bang palakihin itong laboratory na ito thereby necessitating some civil works ay magiging kasama din po ito doon sa ating karagdagan budget na hinihingi for infrastructure for 2021, the letter of which we have already sent to the Speaker of the House. Thank you, Madam Chair.
Madam Chair, may question ako doon sa reimbursement, ay yung pagbabayad ng mga bills ng mga frontliners. Is there a distinction whether permanent ka ba o you are just a job order or volunteer? Does it cover reimbursement kung nagkasakit ka ng COVID?
Madam Chair, permission to recognize Yusek Roger Tong-An to respond. Thank you, Madam Chair.
Yusek Tong-An, you are recognized.
Thank you, Madam Chair, and to our good congressman. Yeah, kasama po sila maski job order or contract of service. Together po yung mga organic plantilla positions. Thank you po.
Yusek, can you take a look at the situation in Region 12, lalo na dito sa South Cot? Kasi may mga job order na frontliners na nagkasakit and ang bill nila umabot ng 100,000. Hello? Madam Chair?
Go ahead po, DS.
Gusto ko lang take a look at the situation of Region 12, particularly the province of South Cotabato, na yung mga volunteer frontliners na nagkasakit ng COVID and continue to be sick right now, na sana mabigyan ng pansin na ma-reimburse o mabayaran yung mga bills nila. At the same time, may question ako, yung nagpapatakbo ng isolation center dito sa province of South Cotabato are volunteer doctors. Are they also entitled na kung magkasakit man sila o habang nagtatrabaho sila, meron ba silang makukuha sa national government sa ngayon? Kasi parang ang tinatanggap yata nila maliit lang because they're volunteers. Pero kung if you get it from bayanihan, 1 and 2, baka naman mas malaki yung ibibigay sa kanila dahil voluntaryo nilang tinatrabaho ito.
Yusek Tong-An.
Thank you, Madam Chair. Congressman, yung pong mga volunteers natin, kailan po nating ilagay na lang sila sa emergency hiring natin para mabigyan po sila ng compensation? Thank you.
Next, who do I coordinate with? Para yung, paano yung nagkasakit na nakabayad ng malaki? Can they still get reimbursement? And is the regional director of 12 authorized na i-hire ito at lalo na yung mga volunteer doctors para may makuha naman sila kasi isa-isa na silang nagkakasakit?
Deputy Speaker Ferdinand, you already consumed po your 3 minutes and that will be your last question na po. Yusek Tong-an, you are
Thank you,
recognized.
Madam Chair. Yes, Congressman, yan po ay i-charge po sa ating PhilHealth po.
Deputy Speaker Ferdinand.
Okay, Madam Chair, hindi masyado clear yung sagot no na I will coordinate with USEC para naman ma-address yung concern ng mga volunteers dito at saka yung mga job orders na kailangan ng tulong dahil nagkakasakit na. May surge dito sa area. So I will ask Madam Chair that I'll be included in the second round. Thank you, Madam Chair. Thank you, Secretary Duque, and to the DOH family. I support increase of your budget and sana ma-turn over na yung SGH hospital dito because to avert a possible health crisis in Region 12. Thank you. Thank you.
Thank you po, Deputy Speaker Ferdinand Hernandez. The next one to interpolate is Representative Sara Ilago.
Maraming salamat, Madam Chair. Magandang umaga sa lahat. Napaumanhin po kanina dahil sa low bandwidth, I had to restart Zoom. Now, for my first concern, Madam Chair, bagamat po sinasabing ang layunin na bigyang prioridad para sa pondo sa 2021 ay ang kontrol ng pagkalat ng COVID-19 at pagpapalakas ng sistema ng kalusugan, napakalaki pa din po ng mga kaltas sa operation, lalong-lalo na ng ating public health program at ng mga DOH hospitals sa mga rehiyon at gayon din sa ating GOCC. Makikita rin natin ito sa pondo mismo ng HFAB na halos nangalahati at nasa 0.42% lang ng buong build fund para sa 2021. Ang isa po sa nakita natin na may napakalaking kaltas ay ang environmental and occupational health sub-program sa ilalim ng public health program at gayon din ang pondo para sa mga blood centers na bumaba naman ng 59%. Maari po nating malaman, una, sa DOH, ano po ba ang kanilang original proposed budget for 2021 at bakit napakalaki po ng naging kaltas para sa mga nasabi kong sub-program sa ilalim ng public health?
DOH, Yusek Villaverde.
Madam Chair, may we request that Yusek Mirna Kabutahe answer that the program is under her team?
Yusek Kabutahe, you are now recognized.
Thank you, Madam Chair. Thank you, Madam Congressman. Bumaba po yung voluntary blood program proposal. Can you just give me a minute? Wala. Tungkol po sa environmental occupational program, ang budget po nila nung 2019 ay 31 million. Tapos po sa kasi po may mga kasamang infra, yung mga pag-build po ng mga sanitation facilities. Sa 2020 budget po, may gumawa na lang ng 2,025,000. Tapos yung sa 21...
Yusek Kabutahe, po, hindi namin masyadong malinaw yung sagot.
Sorry po. For the environmental and occupational health, ang budget po ng 2020 ay 2 million. Mostly po ito para sa ating mga reagents ng ating mga water laboratories. Tapos sa 2021, nasa 2 million lang po ang inapruban. We have requested yung original proposal po natin ay mas mataas because we want to provide additional sanitation facilities at saka gusto po sana nating ma-address continuously yung ating paggawa ng mga sanitation facilities, especially in NCR, Region 3 and Region 4A, para po ma-address yung ating complaints sa writ of kalikasan. Isa po tayo sa mga ahensya na kailangan tumugon sa mga deficiencies ng writ of kalikasan. Ang pinopose natin sa environmental health po ay 154 million. Ang binigay po lang sa atin ay 2 million. Tapos sa National Voluntary Blood Services Program, dalawa pong branch yan. Yung buong programa, tapos po yung ating operation ng Philippine Blood Center. Ang NBBSP budget na proposed ay 661 million. Ang inapruban na budget ay mas mababa. 200 million lang po, Your Honor. 286 million po.
Yes, Madam Chair, kung titignan po natin ang napakalaking cuts sa mga programa na ito sa ilalim ng public health ay tila wala po tayo sa gitna ng pandemya at pagdugon doon sa impact ng public health emergency sa pangkalusugan ng ating mamamayan. Kaya nga naman, nais ko rin pong magtanong tungkol dito sa mga bago namang line items sa ilalim din ng public health program na nasa higit 5 billion. Ito po ang health system enhancement and to limit COVID-19 at saka Philippine COVID-19 Emergency Response Project. May breakdown na po ba itong mga components na ito sa ilalim ng programa ng DOH?
DOH, sino po pwedeng sumagot?
Ma'am, pwede po pakiulit lang yung tanong, hindi po namin nakuha ng kompleto. Salamat po.
May bago pong line item sa ilalim ng public health program, ang Heal COVID-19 at ang Emergency Response Project na nasa 5.2 billion. Ano po ang breakdown nito? Ano po ang mga pagkakagastusan natin?
Madam Chair, permission to recognize Yusek Villaverde to respond to the query.
Yusek Villaverde, you are now recognized.
Madam Chair, thank you very much. Ito po, Congresswoman Elago, these are actually foreign-assisted project for our emergency response sa COVID. This year, this will start, one from the World Bank, and the other project is on the Asian Development Bank. Now, the World Bank has already started, and most of this fund will go to our response to COVID, particularly in terms of our personal protective equipment, yung ating mga laboratory equipment and testing kits, yung ating mga mechanical ventilator, portable x-ray, and the like, even ambulance. Ano po. Now, yung bagong kasasign na loan ng ADB, marami po dito mapupunta naman sa improvement ng ating mga facilities. So mostly civil works for improving our testing capacity, laboratories, at saka po yung ating mga isolation facilities, mga isolation ward po ito. So basically yung po yung dalawang project na to, pareho pong para sa COVID emergency response. Yun lang po, Madam Chair.
Salamat, Madam Chair. Manghingi po tayo para rin sa komite ng kopya ng sources at ng paggagamitan, paggugugulan ng mga nasaad na pondo. Ngayon, Madam Chair, maaari ba nating malaman kung may pondo para sa 2021 ang pagpapatupad ng National Mental Health Law, gayon din ang National Integrated Cancer Control Act? Can we get an update on these laws?
Yusek Kabutahe.
Yusek Mirna, Madam Chair, to recognize. Thank you.
Yusek Mirna.
Thank you, Madam Chair. The budget for the National Mental Health Program is included yung sa budget ng non-communicable diseases for a total of 615,521,000 for commodities. Ang nakalaan po para sa mental health, itutuloy po natin yung ating mga pagbibigay po ng ating mga mental health drugs. Binibigay po natin ito sa mga tinatawag natin mental health hubs. Meron po tayong mga access points sa ating mga ospital, sa ating mga regional offices, at saka sa ating mga RHU para po doon ibigay yung ating mga gamot para sa mental health program. Sa batas po naman, in terms of the mental health law, we have already constituted at nagmi-meet na po yung Philippine Council for Mental Health. Lahat po ng nautusang nakasaad na ahensya ay nagbibigay po ng kanilang mga functions at saka may mga polisiya po na ating minomonitor para makita natin kung paano po yung pagtugon sa mga nakasaad sa batas. Ang isa pong tinitingnan natin, yung National Center for Mental Health, na kailangan pong reference para siya po ang Center of Excellence for the Mental Health Program. Kailangan po, nag-start na tayo na lahat po ng mga facilities ay kailangan may psychiatric wards. Meron po yung magpapilot po tayo ng internal review boards for certain facilities para maisakatuparan po yung mga nasasaad sa batas na may rights po yung ating mga mental health patients na makiparticipate sa kanilang mga treatment. So, and then we have the other members of the Philippine Council for Mental Health, yung ating mga tinatawag na non-government, yung ating mga civil society organizations that are also helping us do many things for mental health. Ngayon pong panahon ng COVID, malaki pong tulong yan for counseling, for training. Despite po na hindi tayo nakakamit physically, may mga online po na mga training, tapos yung mga counseling. Dati po, nung umpisa ng COVID, yung National Center for Mental Health had these hotlines na pwedeng tawagan. Ngayon po, tuloy-tuloy ang mga ating access through these different hotlines by government, non-government. Tapos meron po tayong mga mental health, MHPSS, mental health services para sa mga psychological services, but it's mostly po through the teleconference. Maraming salamat po.
Madam Chair, what about the National Integrated Cancer Control Act? Since I saw in the NEP, no, maski po ito ay talagang kapos na kapos ang pondo para sa susunod na taon. Not to mention the cuts in the preventive and control of non-communicable diseases.
Thank you, Madam Chair.
Yusek
With your
Kabutahe.
permission, Madam Chair, in terms po ng cancer, kasama rin po sa buong kabuuan ng ating 615 million na budget for commodities ang cancer. Kagaya po ng mental health, tumutugon tayo sa pamamagitan po ng pagbili ng ating selected cancer drugs na binibigay din po natin sa ating tinatawag na mga access sites ng cancer. Tapos in-increase po natin doon po sa tinatawag natin, may line item kasi ang DOH na public health management. Tinaasan po natin ang share ng cancer program dito para sa mga ibang suporta, mga training at saka iba pong mga assistance outside of drugs na pwede nating ibigay sa ating mga cancer patients. Alam po natin may our resources are not enough. We have limited resources, but for cancer po, tinaasan natin ng I don't have the percentage, pero tumaas po yung ating budget for cancer assistance. Maraming salamat po.
Yes, Madam Chair, magpapalista po ako sa second round, no? But for my last question for this time po, kamusta po ang PhilHealth para sa mga sangguniang kabataan officials? Ito po ay mga nagsilbi rin nating mga frontliners mula Marso pa lang pagtulong sa mga barangay para sa community-based management ng COVID-19. Ngunit pag sila po ay nagkasakit, talagang pahirapan po pagdating sa suporta. Ano na po ang pinakahuling balita dito?
DOH.
Permission for the chair to recognize PhilHealth. Thank you, Madam Chair.
SVP Nery Santiago, you are now recognized.
Yes, Madam Chair. Thank you, Congresswoman. Regarding sa SK po, sa ngayon po ay sa aming budget po na binigay ng DBM na 71 billion, although meron na pong law regarding sangguniang kabataan, hindi pa po yata nakasama sa provision ng 71 billion na binigay sa amin ng DBM, pero nakasama po siya sa aming proposal na makover po sa budget. Kaya lang dahil po sa kakulangan ng budget, hindi pa po napagbigyan ang aming proposal for the SK. Madam Chair.
Madam Chair, pangalawang taon na ito na hindi inaaprubahan yung budget para sa PhilHealth ng Sangguniang Kabataan. Dapat nitong 2020 pa lang may pondo na yan na 1 billion pero ngayong taon wala ulit. Samantalang napakalaki po ng allegations na hindi napupunta dun sa ating taong bayan na nakalagak sa PhilHealth. No? Kaya ang representasyon po na ito ay muli dumudulog sa lahat ng ating mga kasamahan na i-reconsider itong pondo para pondohan yung PhilHealth coverage sa ilalim ng SK Reform Act. At gayon din, Madam Chair, tayo ay hihingi ng status report para sa National Mental Health Law, sa NICA Law, gayon din ang mga rason mula sa DBM kung bakit malalaki pa rin ang cut sa public health program at sa ating mga DOH hospitals. Maraming salamat, Madam Chair.
Thank you, Congresswoman Zara. Kay Yusek Kabutahe, please take note of that, yung hinihingi po ni Congresswoman Zara. And then I have additional question po regarding dun sa environmental occupational health program ninyo. Ngayon pong 2020, may 350 million kayo. Ano na pong nangyari dito? Nagamit nyo po ba?
Madam Chair, ito po yung tinatawag nating initiative na na binigay para gumawa ng ating mga sanitation facilities. Kasama po siya sa later release. Ang usapan po, nasa saad din sa GAA noong 2020, ang DPWH po ang magsasagawa ng pag-construct ng mga facilities. Kaya po, prepare na po natin lahat ng mga kailangan, tapos binalik na po natin sa DBM, and we are now coordinating with the DPWH para po ma-implement yung project.
So hindi pa ho na-i-implement yung 350 million. And yet, sa 2021, you were still asking for additional 152 million. Ganun po ba?
Yes, ma'am. With your permission, Madam Chair, kasi po yung 330 million for later release po, hindi ho kasama sa comprehensive release. Tapos ngayon lang po, pina-follow up namin, may mga requirements po, kailangan kompleto yung mga projects doon sa Region 3, NCR at saka 4A. Naayos na po natin yung mga kailangan ngayon. Tapos nasa DBM na po para i-transfer na po yung pera sa DPWH. Humihingi po tayo ng additional 150 million for next year para ituloy po natin yung paggawa natin ng ating mga sanitation facilities. Unang-una kasi based on needs, may mga iba-ibang area na kailangan po ng suporta. Pangalawa po, kasama pa rin ito sa ating pagtugon sa writ of kalikasan. Yung writ of kalikasan na unang tinugunan po natin dito, especially sa NCR, among the Pasig River na kailangan po ng mga sanitation facilities. Thank you, Madam Chair.
Pero pwede naman po ito i-full over ngayong 2021, hindi po ba?
I did not get, excuse me.
Maki-carry over siya ngayon 2021 kasi FLR siya, di ba? Para sa 2020. Pwede naman siyang gamitin ngayong 2021 yan. Kasi wala pa namang saro.
Madam Chair, can I ask Yusek Tong-an tungkol for later release ng sanitation facilities, ang alam ko po, itatransfer yan sa DPWH. So, hindi ko po alam kung may saro na ang DOH. Maybe we can ask the finance people.
Yusek Tong-an, you are now recognized.
Yeah, thank you, Madam Chair. Yes, if there will be a continuing appropriation for that matter, because right now we are observing the cost basis. So, yun po. Thank you.
Thank you po. Thank you, Yusek Tong-an. Kasi parang hindi po medyo malinaw sa akin yung pero ganun po man po. Hintayin ko na lang yan. The next one to interpolate is Representative Angelina Helentan. You are now recognized. Representative Helentan. Representative Helen Tan. Nasa Zoom ba? The next one is Representative Lourdes Arroyo.
I'm here.
Madam
Good morning
Chair.
po. Good morning.
Good morning, Madam Chair. Good morning, Secretary of Health, Secretary Duque, and your whole team. First, let me thank you for allowing me to speak. My first question is actually for you, Sec Vergere, and then I will ask you another question and make a small manifestation, Secretary Duque. Madam Chair, earlier I heard that the DOH mentioned the expanded testing protocol. The persons with disabilities, are we included here? Because she mentioned subsectors. So this is for protocol testing. Does this include us or is this strictly for frontliners? Thank you.
Yusek Rosette.
Yes, Madam Chair, and good morning po, Congresswoman. Ma'am, yes, PWDs are included in this expanded testing protocol as we always consider PWDs as part of our vulnerable sector. So, opo, kasama po ang PWD sa expanded testing protocol.
Yusek Vergery, are you giving us a certain amount or all persons with disabilities, the real disabilities?
Yes, it's stated in the... I'm sorry,
Yusek
ma'am.
Rosette.
Sorry, ma'am.
I'm sorry, Madam Chair. Sorry, Madam Chair. I forgot to go. I'm new, so sorry, Madam Chair. Madam
Okay
Chair,
lang
may
po.
I continue?
Apa.
Is there an amount for the persons with disabilities, or is this for all persons with disabilities?
Yusek Rosette.
Yes, Madam Chair and Congresswoman. Ma'am, in the protocol, it is specifically stated that PWDs are part of the vulnerable population and they're included in our high-risk groups and they can be tested. So wala po tayong sinisino, no differentiation, or it is going to cover all PWDs na members po or kasama po sa sektor na yan.
I thank you very much, Yusek Bergery. I thank you very much for that clarification. And now, may I please say something? In accordance with the Magna Carta for disabled persons, it is the mandate of the Department of Health to come up with a national health program for persons with disabilities. How much is your budget exclusively for persons with disabilities? I do not see any item in your budget proposal under NEP allocated solely for the needs of persons with disabilities. Thank you very much.
DOH, Secretary Duque.
Yes, I seek permission of the chair to recognize Yusek Cabotaje.
Yusek Cabotaje, you are now recognized.
Thank you. Thank you, Madam Chair. The budget for persons with disabilities is under the big line item of prevention and control of non-communicable diseases, together with cancer, mental health, lifestyle diseases po. But there is, as we have mentioned in the previous meeting, line item of 68 million, if my memory is right, for assistive devices for our persons with disabilities. Notwithstanding, we still have the technical assistance which are already incorporated. It's one whole budget that can be used for programs for persons with disabilities, including the national registration and the reporting, issuance of identification numbers, and trying to strengthen and expand rehabilitation, habilitation, assistive technology assistance, and support services for these persons with disability. With the permission of the chair, we can have a more detailed breakdown of the specific budgets for persons with disability. We have that available, but I do not have it now. There are several sources po of the funds. One is the public health management for the technical assistance and the assistive devices for the commodities under the prevention and control of non-communicable diseases. Thank you, Madam Chair.
Thank you very much, Madam Chair, you and Yusek Kabotay. How about your information dissemination about your services? Is this ongoing? Because for PWDs, for persons with disabilities, Madam Chair.
Yusek Kabutahe.
Thank you, Madam Chair. Yes, ma'am, our services are continuing to be advocated. We are working closely with the National Commission, NCDA, and with all our stakeholders. We participate in various meetings, and we do this together with all the involved agencies under the NCDA for our advocacy, for our registration, and all the things that are required from the Department of Health.
Madam Chair, are you, I just want to know, Yusek Kabotay, are you aware that the NCDA receives at least 100 calls a day, but they are just there to monitor and for policy making? They cannot give out money. That's why I'm asking this question personally for persons with disabilities. That's the only reason I want to know if there is a separate budget. If not, can you please help us with persons with disabilities? That is all I will ask you. If there is no, because they cannot give money, but they have informed me that they get at least 100 calls a day, at least. So that this is from the NCDA, but they cannot because they only do policy and monitoring, ma'am. So I'm asking you to please help persons with disabilities. And for my last statement, Madam Chair, I would just like to make a manifestation, a short one. Madam Chair, I would like to make a manifestation. It is only during this time of the pandemic that the programs of persons with disabilities are being disseminated, and I am very grateful for this. Grateful is my word. I feel that the services you provide must improve, though, so that no one will be left behind. We cannot leave anyone behind. The update of the registry, which you mentioned, is very important as well, and I am grateful that you're including that. But I don't know, Madam Chair, did I hear correctly? It's only 68 million to be divided among all these, all of us. Am I correct? Yusek Kabutahe. Madam Chair, thank you.
Thank you, Madam Chair. This is for the assistive devices that either we are procuring at the national office or we are giving it for ease of distribution to our regional health offices. In terms of the advocacies, in terms of the communication, health promotion, these are included in our other MOOE budgets.
No more these.
Yes, our efforts are, as I mentioned, are mainly focused on provision of assistive devices and technology. In terms of health promotion, this is included in the whole budget of our health promotion, where they will focus on designing safe and inclusive environments, where the PWD is one of the priority areas that we will work proactively on next year. In fact, the Health Promotion Bureau is now developing what we call the playbooks. It's helping the LGUs improve the environmental settings, the conditions of different areas, which includes those with persons with disability. While we cannot, it's not a separate budget, it's in other budgets, what we call the Health Promotion Bureau. And also, Madam Chair, the persons with the disabilities are also covered by PhilHealth. Some of your, and we have already served 125 million in 2019.
Thank you very much, ma'am. But we know that the list of persons with disabilities, the programs and their allocations you have mentioned earlier. Can you please submit this to my committee, my office and my committee? I'll be very grateful if you can submit this. And lastly, I would just like all of you to know that the persons with disabilities are one of the most vulnerable sectors of our country. It's many of us disabled people are not even able to get PWD cards because they live in our far-flung barangays. There's no accessibility, ma'am. Next, Madam Chair, may I please ask all of you, especially you, Madam Chair, and all my dear colleagues and our dear Secretary of Health to consider, please consider the concerns and needs of our persons with disabilities by providing enough budget for them or strictly just for them. We will see to it that it is used effectively, properly, and well done. Thank you very much, Madam Chair. Thank you very much, Secretary Duque. I know it's difficult for you and you're a very hardworking secretary. You and your team, I thank you. Thank you very much.
Thank you, Congressman Lourdes Arroyo. The next one to interpolate is Congressman Carlos Zaratek. You are now recognized.
Thank you, Madam Chair. Magandang umaga po sa pamilya ng DOH. Madam Chair, I'll go directly to my questions. I think the last time that Secretary Duque and I saw each other was in March 10, before the lockdown, during a committee hearing of the of the Committee on Health. No? And in that hearing, Madam Chair, the good Secretary admitted that he should have declared a public health emergency himself at the earliest possible time. He should have done it sooner than the declaration of the President. No? Kasi nga, inamin niya doon na by January 31, meron na tayong namatay sa COVID. No? So ako yung nagtanong noon at the Secretary admitted that he should have declared earlier, sooner. No? So my first question along that line, Madam Chair, the administration claims that through its implementation of community quarantine, 1.3 to 1.5 million Filipinos are spared from getting infected by COVID-19. No? So may I know now, Madam Chair, how many Filipinos will be spared, if they have a study, if the Duterte administration, as admitted by the President, took the problem of this disease very seriously during the early stage of the pandemic, Madam Chair?
DOH, Secretary Duque.
There is no, thank you, Madam Chair. My limited knowledge as to how many more people should have been spared if, how many more cases would have been avoided if the state of public health emergency had been declared earlier. But what we know for sure is that because of the strict community quarantine that had been approved by the President, upon the recommendation of the Interagency Task Force. According to studies, I think it's WHO or faster that, or NEDA, I think it was NEDA that presented it, that about 1.3 to about 3.5 million cases have been avoided because of this, and about 59,000 to about 140,000 deaths would have been prevented. And among all the other interventions, of course, because the community quarantine is not just one intervention, but it is actually in combination with the other strategic pillars of our pandemic response. The compliance to minimum health standards, for example, how effectively that was done, the detection through aggressive contact tracing, testing, and then, of course, aggressive isolation, and then treatment, and also reintegration. So these constitute the 5 strategic pillars of our national action plan in response to the COVID-19 pandemic. So, yun lang po ang datos na maibibigay namin sa ngayon patungkol po sa mga ginawa ng gobyerno, kanya po na iwasan ang maraming kaso ng COVID-19. Salamat po.
Congressman Zarate.
Thank you, Madam Chair. But again, I think, Madam Chair, we have to put it on record na kung maaga pa ay nagdeklara na sana ng health emergency, ay mas marami pang naisalbang buhay, as admitted by the Secretary before, in March 10. At that time, ang kaso po natin ay hindi pa umabot ng 100. Now, more than 200,000 cases and still increasing. As we speak now, thousands pa rin yung nire-report ninyo na kaso. So, yun po ang gusto nating i-emphasize dito, na after that lockdown in March, to our appreciation, ay naging militarista lang yung tugon, pero ang halimbawa doon sa usapin ng mass testing na panawagan noon pa as early as March, we already proposed that in that hearing. Hanggang ngayon, of course, you labeled it as targeted mass testing, targeted testing, but malayo pa rin ito doon sa ating pinapanawagan, na malawakan at libreng pag-test doon sa ating mga mamamayan, especially the vulnerable sectors. Now, recently naging controversial ito, Madam Chair. The Secretary as Chair of the IATF, bakit ho ninyo, pwede ho bang ipaliwanag sa amin, ano ang scientific basis nitong pag-adjust ninyo sa physical distancing, Madam Chair? As the IATF Chair, I suppose the Secretary is well aware of this.
Secretary Duque?
Yes, ma'am. Madam Chair, wala po yung pong adjustment from 1 meter to 0.75 meters ay nirecall po ito ng DOTR. Sapagkat hindi pa po nakakapagpasya si Pangulo, dahil lang naging usapan po sa IATF, ay magbibigay kami ng recommendation kay Pangulo at nagkaroon naman din po ng pagkakaiba ng posisyon, batay din naman sa kanya-kanyang mga experts advice, na yung kami po ni Sec Ed Anyo, si Secretary Sal Panelo, and si PNP Director General Cascolan, ay ang naging position po namin dito ay panatiliin yung 1 meter physical distancing in the road transport sector. Tapos yung naman kabila naman ay nagkasundo naman po sila, meron din po silang body of experts, na bawasan ng 0.25, naging 0.75. So, in-implement nila yan starting Monday, but yesterday, Secretary Tugade in our IATF meeting informed us that he has decided to suspend that implementation. So, balik po tayo sa 1 meter distancing in the road transport sector. At aantayin po natin ang final decision ni Pangulong Duterte, Madam Chair. Salamat po.
Thank you, Secretary. Thank you, Mr. Chair. Mr. Secretary. But I hope, dahil kayo yung Pangulo, kayo ang nangungulo dyan sa task force na yan, yung siyensya ay dapat mas makapangyarihan, no? Mas lumulutang yung pagdidesisyon ay nakabase sa siyensya. No? At kayo dapat inaasahan doon. No? Although you said that the final decision is with the President, siyempre yung Presidente ay humihingi ng inputs yan. No? Baka kung ano-ano lang desisyon na magawa ng Presidente dahil hindi nyo ina-assert yung scientific basis, no? On that score, Mr. Chair. Now, balikan ko po yung tanong ko kanina, no? Point ko doon sa mass testing. Is the DOH objecting to the conduct of free mass testing for our people as a principle, Mr. Chair?
Secretary. As a principle, we have been guided by the IATF resolution to implement the expanded targeted testing with the prioritization of 10 subgroups. We will happily provide you with the copy of the list so that you might be able to identify which of your sector may fall very well within these subgroups for free testing that will be paid for by PhilHealth.
So what is, Mr. Chair, what is the constraints there? Then, no? Bakit hanggang ngayon ay natali kayo doon sa targeted, no? Ang panawagan ng maraming sektor, free mass testing, especially doon sa vulnerable communities, vulnerable sectors. Bakit hanggang ngayon po ay nandoon tayo, nakatali lang tayo doon sa targeted testing na matagal nang ginagawa ng IATF, Mr. Chair?
Well, Madam Chair, yung pong capacity natin, yung pong RT-PCR ay komplikadong klase ng testing modality ito, ano po. But in spite of that, we have been able to make progress in terms of expanding our capacity from one national laboratory, reference laboratory, which is the RITM. We're now at 117 biomolecular laboratories providing both RT-PCR and gene expert, which are considered the gold standard for testing. We would love to provide everyone the testing if we have the capacity. Ang problema po rito, yung capacity kasi, marami po siyang mga technical inputs na hindi po natin pwedeng mailatag o maibigay kaagaran kasi ito po ay very complicated yung testing process. No? It has to go through 5 steps. Even the certification, the license for these laboratories to have must undergo very rigorous process kasi una-una yung pong testing na ito, hindi naman to parang glucose sticks na yung titignan mo lang sa kamay mo ay malalaman mo na yung blood sugar level mo or sa pregnancy test. For example, ihi lang, meron ng napakadali, no? Ito po ay talagang ang sinusukat dito yung virus mismo doon po sa loob ng katawan. At ang biosafety issue is so important, Madam Chair, Mr. Chairman, kaya talagang sinisiguro po natin na talagang very stringent yung atin pong standards before we allow to let those laboratories operate. Otherwise, doon magkakaroon ng epidemya sa mga laboratories mismo. Kaya ito po, we are very, very careful about ensuring safety in those laboratories. Again, this is a very complicated testing system. So, we're very happy that may mga lumalabas na mga bagong mga testing modality katulad ditong antigen test. Pero bago pa lang po itong antigen testing, very limited po ang ating experience dito. so far, kinakailangan pang mag-pilot test tayo for the new testing modality using the antigen. Ano po? So, nakapagpas siya ang interagency task force na mag-pilot test sa Baguio, ito pong bagong testing system.
Thank you, Madam Chair, Mr. Secretary. No? Kasi talagang napakamahal po talaga nung sinasabi ninyong gold standard, no? Yung RT-PCR. Kaya nga, sa tingin ko, maraming mga kababayan natin namamatay na lamang, no? Na hindi sila na-test dahil nga mahal. No? Mahal yung RT-PCR. Even yung rapid test, no? Dahil hindi naman binawi naman yan. No? So, yun po ang kaya tuloy-tuloy tayong nananawagan na dapat ang IATF mismo is maging advocate, no, ng free. Hindi lang mass testing, free mass testing, especially sa ating mga vulnerable communities and sectors. No? Dahil nga napakamahal nung as it is now, pag pumunta ka ng private hospitals, it ranges from 11 to 15,000, I think. No? Hindi ko kakayanin yan ang mahihirap nating mga mamamayan. Kaya kung araw-araw mataas pa rin yung bilang ng infected, ay saan papupunta ang ating mga kababayan yan? Now, on to my next question related to that, Madam Chair. If the COVID response, no, in this 2020 budget or 2021 budget is a top priority by the administration, may we inquire from the department where in the budget books is the fund specifically, no, is the funding for COVID response? No? Kasi hinalukay ho namin yung budget books. Ay pardon me, no? But if you can point it out to us, walang item for COVID funding response, no? Under the unprogrammed appropriation, what is the item there is social protection program due to COVID-19 amounting to 10 billion, no? Doing the pero andito ito sa unprogrammed appropriations, no? So as I understand it, Madam Chair, pag nasa unprogrammed appropriation yan, ibig sabihin wala pang pera yan, no? It can only be released subject to certain conditions like may excess collections, there is a loan or whatever, no? Na may donation. So subjecting this COVID response fund to conditions for its availment is telling to us the realities, no, sa priorities ng budget na ito ng pamahalaan, no, during this pandemic. When hundreds of billions of funds are appropriated for, say, infrastructure, for this task force to end local communist armed conflict na merong 19 billion, but in specific item for COVID-19 response, it's lacking, if not, it's vague, no? And hindi mo makita, no? So, and it is, the only item na makita natin dito is nasa unprogrammed appropriations pa. So, may we get a response from the DOH, Madam Chair?
Madam Chair, permission to recognize Yusek Mar to guide the body as to what is the level of budget support to implement our COVID response for 2021. Thank you, Madam Chair.
Yusek Villaverde, you are now recognized.
Thank you po, Madam Chair, Congressman Sarate. Yung pong response natin sa COVID, mayroon po tayong ipinasok ang Department of Foreign Affairs na foreign assisted project sa World Bank at saka sa ADB. Ito po ay nabigyan ng cash because of our loan agreements at kinuha po yung source nito ay dun sa unprogrammed fund for this year. Po. So magkakaroon po ng corresponding cash na po yung unprogrammed appropriation. For next year po, isinama na to ng DBM sa regular budget proposal ng Department of Health. Kaya po dun sa aming NEP ay mayroon na pong nakalagay na line item, no? Para po nasa program funds na po yung response sa COVID. Now,
May I know how
Hindi.
much is the line item for COVID response in the NEP, if there is one?
Opo. Yung nasa Opo. Foreign assisted project amounting to 5.2 billion. Yan po ay for next year. Lahat po yan ay para sa COVID response natin, which will include both MOOE and some capital investment to improve our laboratory and testing capacities, to upgrade and to expand our isolation and quarantine facilities, and then to procure personal protective equipment and mga testing kits. But yung po for next year. For this year po, kinuha ng DBM at ng DOF doon sa ating unprogram funds kasi
Madam Chair, if I may, no? Precisely, Madam Chair, next year yung tinatanong ko, no? Kasi hindi pa kahit ng IATF nagsabi itong pandemya ng COVID ay hindi naman matatapos ito next year, no? So malamang next year ang pangunahing problema pa rin natin ay itong pandemya ng COVID, no? Dahil even ang WHO says the vaccine will probably be available in the middle of next year. At hindi naman lahat kaagad ay makakatanggap nito. Kaya ang pangunahing problema pa rin natin na siyang magkakaroon ng epekto sa ating kabuhayan at ekonomiya ay COVID-19. So, dapat ang budget natin for next year, malaki ang nilalaan natin doon sa COVID-19 responses. And you are saying now, Madam Chair, you only have 5.2 billion and foreign assisted projects pa ito for COVID-19 responses. So, yan ang tanong natin ngayon. Problema natin is COVID-19, pero ang ina-allocate natin is only 5.2 billion for COVID-19 responses. You mentioned there was a mention during the DBCC briefing that you requested for 10 billion for PPE, but you were only granted 2.7 billion by DBM. So what kind of priority is that if our number one problem is COVID-19? At gusto kong ibalik, may 19 billion nasa isang task force lang. They can dispense 200 million per barangay. Kung may menu sila doon, patubig, palibing, kung ano-ano pa. But here, our problem sa COVID-19, you're only allocating 5.2 billion. So how is that for a priority, Madam Chair? May we get a response?
Yusek Villaverde, you are now recognized.
Thank you, Madam Chair. Yung pong kaninang nasabi ko ay ito yung line item lang ng foreign assisted projects. We still have some other line items that are related to our COVID response. Like for example po yung prevention and control of other emerging infectious diseases. Most of this will be for PPE, gene experts and the like. 3.7 billion ang proposed for next year. Then yung immunization po, kung magiging available na by next year yung ating COVID vaccine, we have allocated 2.5 billion. Alam po namin na medyo may kakulangan ito kung ang pagbabasihan ay yung sinabi ng Presidente na 20 million kaagad ang i-target. So nag-propose po kami na sana madagdagan ito ng additional na 10.4 billion para po ang ating vaccine budget lang for COVID ay magiging total na 12.9, almost 13 billion. And then meron pong line item din yung operation ng mga national reference laboratories na para ma-upgrade. So marami pong iba pang mga line items na related doon sa COVID response. Opo.
Anyway, just to cut it short, Madam Chair, no? Pahingin na lang ho ng report at listahan of all these COVID-19 responses, no? Coming from the DOH or from, since the Secretary is the head of IATF, no? Ng buong COVID-19 responses natin for next year, no? At ano ang budget nito? Dahil sa initial ko lang natali rito, doon sa binanggit ng ating resource person, Madam Chair, 11.4 billion lang yan. Maliit pa rin yan, no? Kung talagang solusyonan natin. For my last item, Madam Chair, no? Related pa rin ito doon sa usapin ng how we respond to this problem now of COVID-19 pandemic, no? At first glance, kung titingnan natin yung budget ng Department of Health for 2021 compared to previous budget allocations, tumaas pa rin naman ito. No? Taon-taon tumataas siya. Pero kung talagang i-analyze mo, ang paghahati-hati nito, katulad din ito ng mga nakaraang budget. No? Malaking bahagi nito napunta halimbawa doon sa PhilHealth, no? Na 33.59% ang kakainin niya doon sa buong budget ng DOH. No? 71 billion, I think, ang naka-allocate pa rin sa PhilHealth, 71.3, no? Katulad rin ng 2020 level. No? Na alam naman natin ang nangyayari sa PhilHealth ngayon. No? The PhilHealth budget is 15 times larger than the budget of all specialized hospitals. No? Ang lung center, nasa 404 million lang. Ang NKTI is already just given 1.2 billion. Ang Philippine Children's Medical Center, 1 billion. Heart Center, 1 billion. No? So ang tanong ko siguro dyan, kaugnay dyan, Madam Chair, no? Sa ating prioritization, bakit po ang Lung Center of the Philippines and the Philippine Children's Medical Center, despite these two hospitals, specialized hospitals, are considered now as COVID-19 referral hospitals, bakit tinapyasan yung budget nila? Bakit binawasan yung budget nila? May I get a response, Madam Chair?
Congressman Zarate, that will be your last question.
Yes, thank you, Madam.
For your information po, pareho tayo ng tanong. DOH, Secretary Duque.
Madam Chair, we agree that although we propose a higher budget, but the DBM has reduced the budget for the said specialty medical centers. However, I would like to ask if, with your permission, PhilHealth can actually tell us how much of their benefit payouts for 2019 went to these specialty medical centers. So with your permission, I would like now to ask SVP Neri Santiago to give us a partial, the data on total benefit payouts by PhilHealth to these specialty medical centers that the good Congressman Zarate mentioned.
SVP Neri Santiago, you are now recognized.
Yes. Yes, Madam Chair. We are looking up the benefit payouts that we gave to Lung Center and PCMC for 2019. So just give us a minute to call out the information po. As for the dialysis po, we've paid about 11 billion in 2019. Yung eksaktong number po, pwede namin ibigay sa inyo. So, ang narinig ko po is what are the benefit payouts for Lung Center and PCMC po? Yun po yung question. And we are trying to get the information.
Question ko, Madam Chair, no? COVID-19 referral hospitals itong dalawang ito, Lung Center and PCMC. Bakit tinapyasan yung pondo nila? No? In fact, hindi lang sila ang tinapyasan. Lung Center of the Philippines, NKTI, PCMC, Philippine Heart Center, and several other regional hospitals. No? Nabawasan ang pondo nila. Pero ang PhilHealth, maintain, 71 billion pa rin yung PhilHealth. No? Alam naman natin na ngayon ay talagang sa gitna ng daluyong yung PhilHealth. No? At nalalagay sa question kung paano ba yung pondo dyan ay ginugugol. No? At saan ito napupunta. Samantalang ang ating mga pampublikong ospital, taon-taon tinatapyasan yung mga pondo nila na sila yung tinatakbuhan ng ating mga mamamayan, Madam Chair.
Madam Chair, I have with me
Secretary Duque.
Data. Yung pong Lung Center, bumaba siya ng 10 million pesos. Yung National Kidney, tumaas po from 0.91, 910 million, naging 1.27 billion. Ang Children's Medical Center, ito medyo bumaba rin po ito, 1.2 billion to 1.04 billion. Ang heart center tumaas po from 1.43 billion to 1.77 billion. So yan po, tama po si Congressman Zarate, may ibang itong dalawa na bumaba lang center at saka itong Philippine Children's Medical Center. But ang tingin ko po dito, ang assumption ng DBM, I am just speculating, Madam Chair, na baka naman kasi yung PhilHealth reimbursement sa mga ospital na ito, ayan naman po ang pinakamalaking gastos ng PhilHealth, reimbursement po sa lahat ng mga ospital, kasama po ang mga specialty medical centers, kasama po ang mga national government DOH retained hospitals and LGU hospitals and also the private sector hospitals. At meron po silang nakukuha din from the medical assistance to the indigent program. For 2021, meron po tayo 17 billion, Congressman Zarate, for the medical assistance to indigent patients program.
Okay, anyway, thank you for that, Madam Chair. Siguro final na lang talaga. No? Hindi lang sa hospital kasi may nabawas eh. At kung masagot rin ito ng DOH. Halimbawa, binawasan rin yung pondo ng mga programang ito na tingin ko ay necessary din during the time of pandemic. No? Health Policy and Standards Development Program, Health System Strengthening Program, Epidemiology and Surveillance Program, Health Emergency Management Program. All of these programs suffered cuts in your budget. No? Are these programs not important and related to also sa issue ngayon ng COVID-19 pandemic? Yun na, last ko na gusto nating hingian lang ng response from the DOH.
Before I recognize Secretary Duque, I would like to acknowledge first the Minority Leader Benbenito Abante. Good morning po, sir. Secretary Yusek Villaverde, you are now recognized.
Thank you, Madam Chair. Doon po sa huling tanong ni Congressman Zarate, totoo po na yung ibang mga line item ay nagkaroon ng bawas. Ito po kasi yung binigay sa aming ceiling ng DBM. At ang sabi, i-propose na namin yung mga kakulangan sa Tier 2. Pero hindi po lahat ay napagbigyan sa Tier 2 ng aming request. No? So yun po yung final na naging format ng ating National Expenditure Program para sa Department of Health.
Thank you, Yusek Villaverde. And thank you, Kong Zarate. Pwede round 2 if we still have time.
Yes, second round, Madam Chair.
The next one to interpolate is Congresswoman Angelita Helen Tan.
Thank you, Madam Chair. Malinaw po ba ang audio ko?
Opo.
Okay. Just a few manifestations and recommendations for the record and consideration of this August body. The DOH had already presented their 2021 budget to the Committee on Health, which I chaired. Although napansin po natin as yung budget ng DOH ay nalulungkot sapagkat yung kung titingnan natin yung order of priorities ay nasa ikalima lamang ang Department of Health. And sana yung experience natin with this COVID-19 pandemic should have been a wake-up call to our economic managers that we should have given, if not the highest priority, but put more weight on the health needs in our country. So when I asked Madam Chair, the economic managers last Friday, if the government is still committed in the realization of Universal Healthcare Act, DOF Secretary Dominguez answered loud and clear, yes. So Madam Chair, this representation is asking this August body to help increase the budget of the DOH in the following. for the health facilities enhancement program, we only have 4 billion plus for equipment and ambulances, but no budget for infrastructure. So if I may request this committee that the infrastructure will be put not under the unprogrammed fund, but be itemized and be implemented in the regional offices. Number two, to increase the budget for COVID response. As mentioned by Representative Zarate earlier, we really need to increase the fund needed for testing facilities and the IT infrastructure for data management system. Kung napansin po ninyo, last year, nabigyan po ng 1.2 billion. Pero, ngayong darating na taon, 97 million lang po. So, hindi ko po maintindihan kung tama po ba ang pag-prioritize ng Department of Health pagdating po doon sa pondo. Malaking problema po natin yung nangyari, no, na ang reporting natin ng cases ng COVID ngayong pandemic ay marami ang tumutuligsa sa Department of Health because of they find it very inefficient ang Epidemiology Bureau. Pero kung mapapansin po natin, ang dahilan talaga, wala pong robust IT infrastructure ang DOH. So if I may request this committee na tulungan ang Department of Health to reprioritize, no, yung pondo po na dapat mabigay. So number one po yung IT infrastructure natin for data management system. Number two, on legislated or enacted laws po natin na mga programa, katulad po ng National TB Program, 62% for next year po ang slash. But I just want to inform this body na pagdating po sa incidence rate, no, ang COVID-19 po all over the world, number 22 po ang Pilipinas. Pero pag pinag-usapan po natin ang tuberculosis, as to this, I think ang TB po ay number 2 po tayo pagdating sa incidence rate. Ang mental health po natin, no, pag-prioritize po nila para sa pondo ng implementation po ng mental health programs up to the barangay level. Cancer Assistance Fund, yan po ay stipulated sa batas. Ang first 1,000 days at ang HIV law. At ang pinaka-importante po para doon sa preventive aspect ay yung ating immunization program. If I may request also this committee to stipulate in the special provision that procurement of commodities, equipments, including ambulances, be implemented in the regional offices. Also, naging issue po yung who decides on how much and where to go yung ating pong mga infrastructure, katulad ng barangay health stations, fund for the hospitals, and so forth. If I may recommend that the DOH use the Philippine Health Development Facility or Philippine Health Facility Development Plan, which is co-produced or co-developed with Asian Development Bank. Ang intention po nito ay ma-rationalize, no, yung ating pong ginagawa pagdating doon sa prioritization of the health facilities. Next, yung recommendation ko po with DOH to converge yung program po nila in the infrastructure with DPWH in the identification and validation, and that implementation in the construction of these facilities be implemented by the Department of Public Works and Highways. Next recommendation is that although we do have problems in PhilHealth, meron po silang 71 billion na pondo na ibinigay. If I may recommend that this committee reviewed the syntax fund, no? And yung allocation po natin, based po doon sa batas that HFAB should be given how much percent out of the 80%. Kung from 2018 up to 2020 or 2019 na syntax fund po natin na ibibigay po talaga yung pondo para sa implementation po natin ng Universal Healthcare Act. Ganon din po yung ating subsidy, no, ng para sa ating pong mga senior citizens, PWDs, and now yun pong ating displaced workers. Siguro po yung Committee on Appropriation ay dapat i-review po ito at nang mabigyan po ng mas mataas na pondo ang PhilHealth for the full implementation of Universal Healthcare Act. Another, last but not the least, Madam Chair, is for PhilHealth to review yung primary care packages costing for implementation next year. Nabanggit po kanina, Madam Chair, ni Ma'am Neri, na sinabi niya na mag-i-implement po sila ng outpatient benefit package. Pero para sa kaalaman po ng komitibang ito, yung package po na yon ay 500 piso nung nag-present po ang PhilHealth sa akin. Saan po makakarating ang 500 piso, no, na allocation per capita? So, hindi po ang tinitingnan natin ay just to implement and to comply kung ano ang hinihingi ng batas, pero maging sound naman po yung kanilang packages na ibibigay at tutugon siya sa aktual na pangangailangan ng ating mga kababayan. So, Madam Chair, yun lang po yung aking recommendations and I hope that this committee will consider my recommendations, Madam Chair.
Thank you, Congresswoman Helen Tan. And may I suggest that gumawa po kayo ng written request to be addressed to Chairman Eric Yap. Thank you.
Yes, Madam Chair, but this is I think for the record, kahit hindi po ako gumawa ng sulat, ay ang kahalagahan po na dito sa meeting na ito ma-express ko yung aking mga recommendations. But still, I will write a letter to Chairman Eric Yap. Thank you, Madam Chair.
Thank you po. And the next one to interpolate is Representative Stella Kimbo. You have additional 6 minutes given by Congresswoman Castro and Congressman Belmonte. Congresswoman Stella Kimbo, you are now recognized.
Thank you po, Madam Chair. Can you hear me po?
Opo.
You can. Magandang umaga po sa lahat. Kanina po, Madam Chair, nabanggit po na ang budget po para sa mental health program ng DOH ay 615 million lamang. Na ibig sabihin, kung i-divide po natin yan sa 108 million na population natin ngayon, ang lalabas po na budget kada Filipino ay 5 pesos and 69 centavos lamang po. So, nakakalungkot po, Madam Chair, napakaliit po ng binudget for mental health. In fact, this is smaller po than the 2017 budget per capita, which was 12 pesos and 19 centavos. So, ang tanong ko po, una is, ano nangyari po sa budget na yan, considering po na meron na tayong batas na ang IRR po ay pinasa noong 2019. Bakit bumaba pa ang mental health per capita budget? At kaugnay po dyan sa tanong ko, itatanong ko na rin po, no, kung nakapag-create na po ba ang DOH ng Mental Health Division sa isang opisina na dapat po ayon sa Section 42 ng Mental Health Act, dapat meron na po niyan. And siguro isa pa po, no, sabi rin ng batas is ang PhilHealth po ang siya dapat mag-formulate and implement ng National Mental Health Program. So ano na po ang status ng programa na yan?
Secretary Duque.
Yes, again, permission of the Chair to please recognize Yusek Mirna Kabutahe for the response.
Yusek Kabutahe, you are now recognized.
Thank you, Madam Chair. Thank you, Congresswoman Kimbo. The budget for mental health is included in the line item prevention and control of non-communicable diseases so that there is flexibility for the needs that we can go around. While the budget is very low, we have, as Yusek Villaverde was stating earlier, we had proposals for additional budgets. But what DBM told us was to stick to Tier 1, and we propose the additional budgets for Tier 2. We have additional request of 73 million for total for prevention and control of NCDs, but this was not approved, Madam Chair. So we only had the Tier 1 for our medicines, for the medicine access programs in our medical access sites.
Madam Chair, kulang pa po yung sagot sa mga tanong ko. So, meron na po bang strategic plan na siyang basehan po ayon sa batas ng any funding po for mental health na dapat manggaling sa DOH yan? And then number 2 po, yung opisina po, yung mental health division sa loob po ng DOH, meron na po ba yan?
Madam Chair.
Yusek Kabutahe.
In terms of the establishment of the Mental Health Division, we are awaiting the release of the NOSCA from DBM for hiring 8 new personnel, as all the processes and documentations have already been submitted. There will be 2 teams in this Mental Health Division, one to support the Philippine Council for Mental Health that will serve as its secretariat, and for program management. But in the interim, while the NOSCA is not yet available, we have hired job order contract of services to help us in the mental health program, Your Honor. In terms of the strategic plan for the National Mental Health Program, under the Philippine Council for Mental Health, we have prepared the strategic plan, and this is being developed and being fleshed out where we had the different stakeholders. So since it's a total mental health strategic framework, it's not only the DOH, but we're working with all our stakeholders, identifying the many things that have been required from the law, Your Honor. And we can provide the strategic plan, a copy of the strategic plan to the committee, Your Honor, Chair, Madam Chair.
Madam Chair, nakakalungkot po na tila napakarami pong or napakahaba po ng delay pagdating po sa pagpapatupad po ng Mental Health Act. At baka yung kawalan po ng isang programa ay baka yan din po ang dahilan kung bakit hindi natin mapa-increasean ang budget po para sa mental health. So nakikiusap po ako sa officials po natin sa DOH na sana po i-prioritize yan. Ngayon po na panahon ng pandemya, lalong-lalo na po ang ating mga kabataan na halos na tumatagal po silang online. And alam naman po natin na ang social media po ay isang trigger po ng mga mental health concerns. So napaka-vulnerable po, lalong-lalo na po ng kabataan natin ngayon sa mental health issues po. And for my next question po, I'd like to ask Secretary Duque po tungkol sa PhilHealth. Mr. Secretary, are you aware po ba na may projected deficit po ang PhilHealth sa taong 2021 ng halos 86 billion pesos po? At ano po ang ipinaliwanag sa inyo ng PhilHealth kung ano po ang dahilan kung bakit magkakaroon po ng ganyan kalaki pong deficit?
Secretary Duque.
Ang pagkapaliwanag po sa akin ay yung projected collection ay naapektuhan nito pong pagbagal at pagsara ng mga kumpanya itong second quarter in particular. So yung projected collection ay hindi maaabot, although meron pa rin daw naman na increase compared to the same period of collection last year versus this year. Pero malaki po ang gap in terms of the projected collection, bearing in mind that this year of the UHC implementation, dapat ay yung collection mas malaki dahil nga nag-increase yung rates from 2.75 to 3%. Ano po? And plus, of course, a projected benefit payout during this pandemic response. So, yun po ang dalawang kadahilanan na lalaki yung benefit payout, affected ang collection, may marginal increase in collection but far from the projected collection for this year. But anyway, andito naman po si VP Neri Santiago to give us a more detailed explanation. Thank you, Madam Chair.
Madam Chair, if you don't mind po, maganda kasing kausapin si Sec. Duque bilang chairman of the board para malaman din natin po kung ano po yung information po na ibibigay po sa kanya ng mga officials po, if you don't mind po. Anyway po, tama po kayo, Secretary Duque, malaking problema po yung under collection na mangyayari po next year. Pero with all due respect po, Secretary, nung binusisi ko po yung actuarial projections po ng PhilHealth, tila ang projected po na under collection ay mangyayari po hindi po sa employed, hindi po sa private employees at hindi po sa government employees. Subalit doon po sa tinatawag na individually paying program members at pati na rin po ang OFWs, pati na rin po ang mga enrollees po at point of service na wala pong kakayahan magbayad po ng sariling premiums. And ayon po sa aking projections or sa aking estimate, ang under collection po ay 28%. In other words po, 68 billion pesos ang lumalabas na sa ngayon pa lang po ay pinoproject na ng PhilHealth na hindi nila makokolekta. So ang hirap pong intindihin po, no, Sec, na as early as now, they are already projecting not being able to collect 68 billion pesos. Kaya po nagkaroon ng deficit na 86 billion pesos. So, have you been apprised po of this situation? And meron po bang plano moving forward para po ma-plug ang leakages na yan nang dahil po sa under-collection efforts po ng PhilHealth?
Tama po kayo na yung collection sa OFWs ay malaki po ang epekto nito. Hindi po rin nakamit yung pinupuntiriyang collection target. Pero yung pong mga detalye nito kasi, pasensya na po, ay hindi ko maalala lahat. Although in the briefing made by PhilHealth, I think siguro yung mga datos na ito pwede kong ipagpaalam kay Chair kung pasagutin po natin si SVP Neri Santiago para po mas malinaw at kung ano ba ang kanilang iminumungkahi sa PhilHealth Board para po mapuno yung puwang sa pondo ng PhilHealth to achieve actuarial sustainability over the long term and meeting its benefit payout obligations. SVP Neri.
SVP Neri Santiago, you are now recognized.
Yes, Madam Chair. Thank you, Congresswoman Kimbo. Regarding po dun sa how we can plug yung leakages po, no? We are strengthening po yung aming accounts monitoring. And at the same time po, we want to go to other means of payment especially yung online payments. Sa ngayon po kasi ang nakakapag-online payment lang ay yung ating mga employers, pero we want to open this up to individually paying as well as especially dun sa mga OFWs po natin na ang access po talaga nila is usually through online payments. So, yun po yung, another thing po is to segmentize yung pong ating, especially the informal. Kasi sa ngayon po, ang informal natin, nahihirapan po tayong maningil dahil usually po, ito po mga self-paying ay nagbabayad lang pagka nangangailangan sila ng mga benepisyo ng PhilHealth. So there is an adverse selection pagdating po sa pagbabayad ng premium. So yun po yung kailangan nating i-strengthen pagdating po sa pag-reach out to this, especially yung mga tricycle drivers, fisher folks, farmers, jeepney drivers. Maski po siguro through associations na meron sila, we can reach out to them para po makasama po sila sa makakapagbayad ng PhilHealth. So ma-strengthen po natin at madagdagan po yung ating collections. Pagdating naman po dun sa indirect, medyo mababa po kasi at hindi po na pagbigyan yung aming kahilingan na magbigay ng mag-provide ng subsidy for the 138 billion. So 71 billion lang po, na pareho pa rin po nung 2019 at saka 2020 may dagdag lang pong 4 billion despite the COVID situation. So wala pong naibigay na pondo para po sa COVID packages natin as well as dun sa COVID testing. Kaya po yun po yung kadahilanan kung bakit kukulangin po yung ating pondo by next year. Yes, that's all, Madam Chair.
Madam Chair, linawin ko lang po, maliwanag naman sa batas na ang kokolektahan yun na lang po na informal sector ay yun lang lamang pong may kakayahan magbayad. At base sa numbers ninyo ay marami-rami din po yun. Pero ang sinasabi ko nga po, dito po sa merong kakayahan magbayad ay tila ngayon pa lang po ay sineset up nyo na po ang sarili ninyo for failure. So ang sa akin po pakiusap na sana po ay wag naman po ganito at wag nyo na lang po basta-basta na lang pong ipasa sa gobyerno ang burden, bagkus maliwanag sa batas na responsibilidad nyo po yan. For my next question po is, meron po bang mental health package po ang PhilHealth?
Secretary Duque.
Meron po tayong mental health package, but the details of which I would like to request PhilHealth to answer.
Yusek Neri Santiago, you are now recognized.
Yes, Madam Chair. Thank you, Congresswoman. Regarding sa mental health package po, currently, wala po, meron pong packages na based on case rates, codes, pero po in terms of yung package talaga for mental health, ay wala pa po. Ang plano po is this will be part of the comprehensive primary care benefit na ilalabas po at enhancement po to sa benefits sa ngayon. So it will have to pass through the HTA paggagawa po natin ng bagong package, and sa ngayon po ang plano is this will be part of the enhancement in the primary care benefit. Over, Madam Chair.
So, Madam Chair, wala pa tayong package for mental health, pero meron kayong balak i-introduce na bagong package, which is the consulta package. Ang tanong ko po kay Secretary Duque is, ito po ba ay na-approve na po sa board? Napag-usapan na po ba ang consulta package and its details po, Mr. Secretary?
Secretary Duque.
This has already undergone board deliberation. Ang alam ko po ito ay aprobado na ng PhilHealth Board, yung pong consulta package.
Aware po ba kayo, Mr. Secretary, na ang treatment po ng consulta package ng PhilHealth, ayon na rin sa actuarial projections ninyo, ay hindi po ito insurable. Ibig sabihin, doon po sa pag-budget ninyo, ay nag-budget po kayo ng 625 pesos for every Filipino para po sa outpatient care. So ako po ay in favor of that. Kailangan na kailangan po natin ng primary care. That's very important po para po mapababa natin ang hospitalization rate. Pero ang tanong ko po is, Tama po ba na ang dapat na magbayad po niyan is PhilHealth rather than DOH? Considering po that you treat it as a non-insurable item. Ibig sabihin, sure na gagastusan nyo ang bawat Pilipino ng 625, in which case, it's like a subsidy. So ang tanong ko, bakit ninyo nilagay sa insurance program po natin yan? Kasi ang kahalagaan po no ng tanong ko na to or concern na to is that kakain po siya sa budget ng hospitalization. Kasi this is going to be a sure expense. So itong 68 billion na nakalaan for consultation yan po ay makakabawas po sa budget na pwedeng gamitin po para sa inpatient or hospitalization po, Mr. Secretary.
Secretary Duque.
Siguro po matutugunan nito at the policy level. Kasi yung pong PhilHealth, meron po siyang tinatawag natin na capitation payment for outpatient benefit package at nakasaad po ito sa batas at kanya pinalalawig po natin under the universal healthcare ang pagbibigay po ng primary care services. Ngunit alam po natin na ang budget ay kukulangin para dito. Pero ganoon pa man, in principle, talaga naman matagal nang binabayaran ng PhilHealth through capitation payments ang mga primary care benefit package. Since kailan ba ito? Even before, nagbabayad po talaga tayo ng mga outpatient benefit package sa mga LGU facilities and even kung naaalala ko, but I would like PhilHealth to remind me or to correct me kung tama po yung aking pag-alala, meron din pong outpatient capitation, yung mga hospitals na meron pong OPD, outpatient department na bibigay po ng ating primary care benefit packages. So I don't know kung at what policy level or policy needs to be introduced na gaya po ng sinabi ninyo, baka sa DOH na lang dapat ito. But sa kayo po kasi ang DOH, pinag-aaralan din po yung tinatawag natin population-based and individual-based services. So may plano po ang atin pong Yusek Villaverde might be able to give us a clearer picture of how or at what stage of the plan is this being implemented with the permission of the chair.
Yusek Villaverde, you are now recognized.
Yeah, thank you po, Madam Chair. Doon po sa framework na ginawa between DOH and PhilHealth at isinangguni din ito sa iba pang mga stakeholders base doon sa ating Universal Healthcare Act, ang major funding support for population-based health services ay ang Department of Health in complementation with our local government units. At yung pong individual-based health services ay PhilHealth ang major source ng financing. At pagdating po sa primary care level facilities, yung pong mga package na mga ambulatory care and individual-based healthcare ay PhilHealth ang medyo mag-finance na noon, kaya yun ang nakasaad doon sa kanilang konsulta package. Whereas at the primary care level, yung pong mga population-based health packages katulad ng epidemiology and disease surveillance, health promotion, vector control, kasama na rin yung mga quality assurance sa water and sanitation and disaster risk management. Ito po ay manggagaling sa mga line items o programa ng Department of Health. So yun po yung delineation ng financing scheme doon sa ating mga healthcare packages. sa primary level facilities.
So, Madam Chair, ang tanong ko lang po, sigurado ba tayo, Yusek Mar, na walang double counting na nagaganap? Kasi nga po, merong counting budget para sa primary care sa LGUs. Nagtaas din po tayo ng budget para sa human health resources po, which is lodged po sa DOH budget. Tapos ngayon po, meron pa pong 625 pesos per Filipino na naka-lodge naman po dito sa PhilHealth. So kayo po ba ay nag-determine na kung sigurado ba tayong walang double counting dyan? And my second question, kaugnay pa rin ng outpatient care is, bakit po sa assumptions ng PhilHealth is mataas pa rin ang utilization rate o ibig sabihin ang tsansa na ma-hospitalize ang isang Filipino, considering that tinataasan na natin ang gastos natin sa outpatient care? Hindi ba dapat kapag mas may nagpapacheck up ang mga Filipino, mas may access ang Filipino sa pagkonsulta sa doktor, ay dapat mabawasan na po natin ang hospitalization rate. Napakataas po ng assumed hospitalization rate, lalong-lalo na po sa informal sector. Ang assumption po ng PhilHealth is 32% for every person. In other words, once every 3 years, maho-hospital po ang nandun po sa tinatawag na informal sector. Yusek Mar?
Yusek Villaverde.
Thank you, Madam Chair and Congressman Stella. Yung pong double counting na sinasabi ninyo, sa kasalukuyan po, yan nga po ang nangyayaring sitwasyon. At ang aming expectation ay ang Universal Healthcare Act ang siyang medyo aayos nito. Nasa transition po tayo ngayon, no? At mayroon naman na issue na kami na guidelines on how we will transition some of the public health programs from certain scheme, no? Na yung iba ay population based, and papaano siya eventually mata-turn over sa PhilHealth kung individual based yung kanilang scheme, no? So ito po inaayos namin sa ngayon, and we believe that in the next 2 years yung transition natin para mas clear at clearly delineated yung ating distinction between what is currently being financed by DOH and what will be financed by PhilHealth sa primary care facilities, ay mas ma-avoid natin itong double counting or double compensation.
And Madam Chair, just to wrap up po, no? So tingin ko po, Yusek Mar and Secretary Duque, siguro po ma-avoid po natin itong posibilidad ng double counting kung tayo po ay may proper review po nitong bago pong benefit package, which anyway naman po is required by law. Every time po na mag-introduce tayo ng benefit package, dapat po may proper review. In fact, pwede lang tayo mag-introduce niyan kapag meron pong excess fund. Hindi po sa panahon po ng isang deficit, kung talagang totoo ang deficit na yan. Number 2 po ay, well, since nandun na nga po ako sa deficit, sa tingin ko po talagang imposible po na ganyan kalaki ang expected deficit sa PhilHealth. Ito pong 86 billion pesos. Hindi po mangyayari yan kapag sineryoso po ng PhilHealth ang trabaho po nila, pag naiintindihan po nila ang mandato nila, naiintindihan nila how an insurance program works. Hindi po dapat mangyari po yan. So, ang pakiusap ko lang po is kung sana po repasuhin ulit po ang actuarial projections, and sana po mabigyan po ang committee na ito ng isang fund viability plan para naman po may kasiguraduhan tayong lahat na hindi po mamamatay ang PhilHealth nang dahil lamang po hindi tayo nag-exert ng enough effort po, lalong-lalo na po sa pag-collect ng premiums ayon sa batas po. So, yun lang po, Madam Chair. Maraming salamat po.
Madam Chair, if I may be allowed to just
Yusek Duque.
to raise a point with the Congresswoman Stella. Siguro pag-aralan din po natin, dahil tama po kayo, ang isa sa mga hamon na kinaharap ng PhilHealth ay yung talagang kahirapan kumulekta sa informal sector. Pero gusto ko lang pong palutangin ang issue na halimbawa po, ang formal sector premium contribution, meron pong meron pong employee and employer share sa kanila pong contributions para po sa mga empleyado, both in the private and in the government sectors. Pero ito naman sa informal sector, sila po ang buong nagbabayad, wala pong counterpart funding na nanggagaling sa employer. Hindi po gaya sa government service, GSIS, ang gobyerno po, not GSIS, but ang gobyerno po mismo nagbabayad ng counterpart funding, no, based on the formula. Ganun din po sa mga private employers, no? Sila po nagbabayad kalahati ng premium contribution ng kanila pong mga empleyado o manggagawa. Pero kung titingnan po natin, yung informal sector members, ay halos sila lang po talaga ang nagbabayad ng buong premium contribution. At of course, yung mga professional groups, no, yung mga self-employed, may kakayahan naman, may taglay na kakayahan, bayaran ng buo yung kanila pong premium contribution. Pero karamihan po sa atin mga miyembro ng underground economy o ng mga informal economies ay talagang walang kakayahan. Kaya ang naging posisyon ko po dito, dapat siguro talagang bigyan din ng subsidy itong sektor na ito para makatulong din po sa overall sustainability ng sistema. At gusto ko po sanang talakayin ito with you at another point, ma'am, kung magkakaroon po ng pagkakataon. Salamat po, Chair.
Madam Chair, panghuli na lang po. I agree with you completely po. Yung wala pong kakayahan, i-subsidize po dapat yan ng gobyerno. Pero yung pong may kakayahan ay dapat pong kolektahan. And based on your numbers po, hindi naman po tama na lahat po ng Pilipino ay walang kakayahan. Napakalaki na po ng numbers po na nakalagay po dyan. More than 30 million po ang nakalista ninyo na walang kakayahan. Sa tingin ko naman po, marami pa rin Pilipino ang may kakayahan pong magbayad. Kailangan lang talaga maging attractive ang programa ninyo para nang sa ganon ay voluntarily po ay mag-participate ang mga Filipino. Kasi po kapag hindi po masyadong magandang programa, mag-opt out na lang po ako. Dahil sa totoo lang po, mas mura pa po minsan ang private health insurance plans kumpara po sa PhilHealth at mas maganda pa. So yun ang gusto kong puntiryahin. And panghuli na lang po, yung fraud control po. Ang isang dahilan po kung bakit napakalaki siguro ng deficit ay wala po ako nakitang fraud control measures na matindi po na binabalak nyo. So kung pwede po sa submission ninyo, tungkol po sa fund viability plans ng PhilHealth, pwede niyo po bang isama po doon ang fraud control measures na binabalak niyo po for 2021? Maraming salamat po, Madam Chair.
Thank you, Madam Chair. Yes, we will comply with the directive of the committee. Thank you, Madam Chair.
Thank you. Thank you po, Congresswoman Kimbo. I would like to inform everyone po na magkakaroon tayo ng break. 30 minutes break po. So by 1:09, dapat po nandito na ulit tayo. Thank you. Para po sa mga nasa Zoom, magkakaroon po kami ng 30 minutes break. Kung Salo, after break po, next na kayo.
Thank you very much, Madam Chair.
1:09 po ang balik dito.